You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior
and Nurse Anthony.
Yes, sir. This is the season finale of season 2.
Let's go.
Episode 20. Make sure y'all like, subscribe, comment.
Hey.
Facebook, TikTok, Instagram. Subscribe on YouTube, of course. Tell a friend, tell another friend.
To tell another friend.
You know how it goes. We got a special guest for the season finale.
We got Irvin.
You guys hype me up too much, man. You guys hype me up way too much.
Yes, sir.
Yes,
Congrats.
sir. Yeah,
you passed the NCLEX.
I did. I'm actually registered. Everything. All done.
Let's go.
Yeah, just waiting for somebody to say yes. Put me on the roster.
Yeah, it'll come, bro.
I'm hoping. I got something with one of the hospitals across the waters there, so I'm just waiting for them to give me a shout, see if it works.
Yeah.
They said they had an influx of people coming in, so they're just kind of.
This is overseas or
No, just across
Detroit.
Oh, okay.
Yeah, like water, not international. Just
well, it is international water.
The river,
international water.
River,
just a hospital across the road there, but we'll see what happens at the end of this week. So,
if you could choose, where do you think you'd be? Here or there?
You know what? Everybody's saying go over there.
More opportunities.
The American dollar's better over there.
Yeah.
The benefits of the American dollar, credit cards, all that stuff over there is just it's elite, right? I got my brother, and my sister work there.
Yep.
And it's just I think it makes sense for me to go over there.
And you know what they say? Uncle Trump's in office now, so you know they say that the
dollar's going up. Bitcoin, Dogecoin, all that.
So, hey man, I don't know what goes on with all that stuff. All I know is American dollar might get stronger. So why not, right?
Absolutely, bro.
Take advantage of it.
Yeah, you're
100%. So nursing. Why did you decide to go into the profession of nursing? Is this your first?
So I'll be honest with you. So nursing was like a second option.
Yeah.
So to keep it short, the profession that I'm doing now, they kind of cut me off first, at the beginning. I failed a certain like skill testing portion of it, so they kind of retracted the offer that I had originally. Yeah. So I was left with like, what else do I got to do? Like, what can I do? At this time, I was living in my parents' basement.
Yeah.
My girlfriend, now wife, that's with me, was living with me, and it's one of those things of like,
congrats.
You know, what I got to do, man.
Yeah.
I got to try and make this work. So
for sure.
Called a couple people, called St. Clair, figured out what I needed to get into the nursing program. So they told me I had to do a couple of extra credits. Technically, I had to finish a pre-health course that I did 10 years ago.
Which is surprising.
Yeah.
I don't know if you want to share this, but you're an EMT.
Yeah.
So this is where I'm surprised because your guys' program, that program is crazy difficult.
It's tough because it's condensed, right?
Yeah, that's right.
And it's like emergency medicine. But like, again, I find that like our education system, they don't care. They want you to pay the full price. They want you to be there full time.
Yeah. And
just pay top dollar and just they stop caring about what your previous credentials were.
Yeah.
But again, my credentials were 10 years old, right? Like this is a course pre-health I took in 2010.
That's crazy, bro.
And so there was a teacher back in the day that told me I didn't have to take a certain class, so I never took it.
Yeah.
10 years later, one of the individuals who was trying to get me into nursing was like, "You're short of credit." I'm like, so I looked back and I'm like,
should have done it.
I should have just finished it, right? So I had to finish that credit plus upgrade a certain credit, and then the only opening was in Chatham actually. So I ended up traveling back and forth to Chatham, trying to make it work, man. Yeah, so in the first 2 years, right, because it was COVID, they provided me grant money for it.
Yeah.
So I did the 2 years essentially on Canadian dollar, like on grant money. And so when I got hired as an EMT 2 years later, essentially, it was one of those situations like, do I just keep going?
Yeah.
Or do I take the hit, make the grant become a loan, and then I had to pay essentially almost 20 grand back. So I was like, I'll just finish the course. I'll just finish nursing.
Yeah.
And I wasn't sure where EMT was going to take me, right? Like, I didn't know if I was going to 100% love it. I do love it.
Yeah.
I still love it.
You just kind of had to finish what you started.
Yeah. And that's the way I've always been, right?
Yeah.
Like, my wife knows it. My wife kind of hates it because once I, like, dive into something, I just have to focus, get it done. however long it takes me.
You know what she's not going to be mad about? You dived into marriage and you ain't leaving that. This is what you ain't going to be mad about.
It's an everyday battle, man, and marriage is fantastic. It has all its ups and downs, but at the end of the day, I think it's something that she definitely doesn't have to worry about. I always tell her, like, we never joke about, being apart. We never joke about divorce, none of that stuff. I heard that one time over like a TikTok and somebody saying it. And ever since then, I told her we don't play about that. Yeah. So we just work it out, man. She knows the way I am. I know the way she is, and we'll work it out. And every day is always a new day, right? So it's always, we just kind of scrub it, I guess. No pun intended.
So what was
Shout out to the scrubbers.
Yeah, we scrub it. We scrub the past, and we start off fresh the next day. And
so what was it like being in the nursing program and also working essentially in emergency medicine at the same time?
It was good. Gave me a lot of insight into, I guess, with the Canadian system, like why things are backed up.
Oh, yeah.
And it's obviously no fault of the nurses and whatnot, but you kind of see both perspectives. You see like the emergency, people at home, their conditions, what they're going through, what they're coming in for. And then right after that shift, you go into a 12-hour preceptor shift and you're like, hey, I've seen you.
Yeah.
Or I know who that person is, or I've seen people in that same predicament and they're in the hospital for 2 weeks, 3 weeks, and it's like you understand where one person comes to the emergency bay and then they end up on the floors and how long that takes and why the turnover rate is lengthy. Yeah. So then you see what's going on at the top and you see why the bottom is getting essentially backed up all the time and why
absolutely
that's
interesting. Right? I never thought about
that. So you see both perspectives, but you also get, I guess, upset about what goes on in both aspects, especially from the nursing perspective of just like the communication that has to occur on the floors for things to move, and it never, like, sometimes the communication isn't there. Yeah, that's something that I've noticed, right? So, and that's still from the student perspective. Yeah. Right? That's not from the full-fledged nurse perspective yet. I'm sure you guys have more experience with that, obviously, but from the student perspective, I only know what I know. Yeah, and all I see is certain things not moving as quickly as I think they should move. But again, I don't know all the process, right? So you get to see both sides of the coin there.
Yeah, that's cool, though.
So you've seen healthcare from a holistic standpoint, basically. So as an EMT, can you kind of go into depth on an everyday like what you guys do?
Like on an emergent level?
Yeah, on an emergent level. What's the process on that? I guess an operator will call and let y'all know, hey, we have a situation going on at this address. Yeah. Can you go into depth?
So essentially, like, again, with the city the way it is, you kind of get an idea of what your, like, what kind of population you're dealing with whenever you show up. So you kind of have that predisposition of, like, if you're going to this place, you know what kind of call it's going to be. If you go to this location, you know what call it's going to be, right? Right. Downtown versus South Windsor versus, West Windsor, et cetera, right?
Right.
But from the perspective of like the EMT, it's more education based. Like I find that like nursing is education based, but it's also as working like with that knowledge of a nurse, I personally try to educate more with people calling for what they call for. Yeah. Sometimes it's not an emergency.
For sure.
Right? Yeah. Other times it is an emergency, right? So I try to educate people, but at the end of the day, it's their call. They want to go to the hospital. They want to do the weights. They want to get assessed. Yeah. Who am I to say no? Who are we to say no, right?
Some people are in an emergency and won't identify that they're in an emergency.
I've had a couple of people where they're like, dude, you should go. Yeah. Like, I don't want to hold anybody up. I'm like, you're not holding anybody up. You're holding yourself up.
You're going to go to the top of the list, buddy.
ABCs, you're actually number one to be seen once you get there.
Yo, check this out. This reminds me of a story. One time, this was last year, we had a dude on our unit. He is like a contractor, right? Like he does construction and shit. Yeah. And he was having like just an absurd amount of leg pain. And he was like, like it'll just go away. Like no big deal.
What kind of leg pain are we talking about? Are we talking like the Peter Griffins? That type of leg pain?
Nah, he was just like, yo, I'm going to thug it out. Like I'm at work. I'm not going to leave work for some fucking leg pain and go see my family doctor.
Like that, man. It's always those hardcore dudes.
Yeah. So he goes to the emergency room and he's there for like an hour and he's like, bro, I got like 7 more hours of this. He's like, it ain't that bad. I'm going to just wait till the morning, go see my family doctor, and just, whatever. Next morning comes, he goes to work again, and he's obviously the pain is kind of increasing.
Yeah.
And so he, I guess, knows a nurse somehow. He's telling me this story. He knows a nurse somehow, and he's like, yo, I've been having this like crazy amount of leg pain. I just want you to just take a look at my leg, and like just tell me what I need to do, because I think I'm gonna go see my family doctor after I'm done work. So they're on like FaceTime, I guess, and he like shows her his leg, and she's like, yo, call an ambulance.
Call an ambulance.
He was like, what? No, like I'm straight. She's like, yo, right now. Like right now.
Is that bad?
Bro. A week later, above knee amp, gone.
Hell no.
Yeah, gone.
You know what's insane about that though is that same notion where it's like call an ambulance, but the guy's been walking. The guy's been chilling.
Right.
Yeah.
Which I get. Hey, by no means you need 911. You call us.
Yeah,
but
absolutely.
it's one of those situations where it's like people are telling people to call 911, and in that situation, it's been a long-standing problem.
Yeah.
Again, he went to work. He's fine. But for some reason,
2 days in a row, like
there's nothing we can do about that.
Yeah.
Right?
Yeah.
The way that it works with us is the same it works everywhere else. It's a triage system, right? So it depends on what's going on.
Yeah.
But if this guy literally is just complaining of leg pain, then it's like we're a taxi. Right?
No, but here's
we're
my
a taxi.
thing. Sure, you're absolutely right.
Right?
So my thing is, though, like, if this woman could identify the severity of his problem on like a FaceTime.
Yeah.
Let's say if he called an ambulance and you were to come, I'm sure you can make that assessment and be like, yeah, we got to go, buddy.
Yeah, no, and
you know
it's
what
true.
I'm saying?
And then again, like you were saying earlier, right? It's one of those things where it's like the people who think they don't have to go are actually super tough and like they should go. So you're right. If I would have shown up to that, my pre-thinking would have been like, really? Leg pain times 5 days?
Yeah.
Like, we probably wouldn't have gone lights and sirens.
Absolutely.
Right? We show up. It's those things where it's like, man, why did you call us 2 days ago, 3 days ago?
Yeah.
All right.
Bro,
like,
I will commend this guy, though, too. He was in, like, good spirits the whole time. He's just like, yo. And so I happened to, like, go to high school with his son. So I actually, like, knew. And his son came up on my Facebook. And I was just like, yo, how's your pops doing, you know? Yeah. He was like, bro, he got his prosthetic, like, a week after he got out of the hospital. And my guy's already back to work. I was like,
wow.
See what I
that's
mean?
fucking
But
crazy,
those are
bro.
the tough dudes that I'm like, you could have avoided that.
Yeah.
And you needed it. And then we get people calling with a stub toe.
Oh, my God, bro.
I'm like, bro, come on.
Yeah.
Right? But then you got these tough as nail dudes where I'm like, you should have gone forever ago. And
Yeah,
it's like,
you're
those are the
absolutely
reasons you should call.
You're absolutely right.
Again, there's...
But this is also, like you said, it comes down to education.
Yes,
People knowing what really is important and what isn't, or what is a medical emergency and what isn't.
And I don't think there's enough education out there, because at the end of the day, I think what it comes down to is liability, right?
For sure.
So if you're telling people don't call for this, well, not that you shouldn't call, because I think we have something out there that's like, this is clinic related, this is doctor related.
I know what you're saying.
This is right.
I've
You've
seen
those where it's like left, right.
Yeah.
But again, you can never say, don't bother calling us.
Right.
If questionable, call 911. Right.
Of course.
And so a lot of people use that, but I think what I find is that in our community, people are still under the impression that it's faster.
Yeah, you're right.
And that's one of the biggest things. It's not faster. It's always a tier system. It's whose life or limb.
Well, of course.
Right? So and we
it
guys
has to
know
be.
that.
Yeah.
So, but they don't know that, right?
Yeah.
The 90-year-old, 80-year-old doesn't know that. The people who who really rarely ever call for 911 know that. They just assume it's faster. So.
Yeah.
So in your experience, what would you say was probably the craziest call that you received as an EMT?
Honestly, it would have to be somewhere up north when I was working.
Yeah.
It really comes down to car accidents, right? Like usually those are kind of like the significant ones. Up north, you got speeds of 80, people going 100, 120 on those long highways, right? Yeah. So it's always those big open roads. And those I find are the ones that have like the most significant type of calls, because sometimes I haven't done one myself, but I've heard, truck transport versus buggy.
Oh,
right?
What?
So it's buggy, and it's usually people with, families of 10 on those buggies.
Oh man.
It's just one of those things, either visibility or they're at night or people just aren't paying attention. And these are calls that I've heard, right? I've heard, buggies getting struck with horses and they're 100 meters out into the ditch.
Holy
and
fuck.
it's just not a good scene for a lot of people, right?
Yeah.
Well, for
Holy
myself,
shit.
I've done a call where, 3 people didn't make it, right? Transport versus van. And it wasn't good for anybody.
Yeah,
Right? And it's just one of those calls where it's a tough call, but it's an obvious call,
for sure.
right? You show up and you're like, we have to work this because it's now.
Yeah.
But it's one of those things where that's going to be a phone call to somebody saying, hey, this is a situation. Do we keep resuscitation going or not?
Yeah.
Sometimes it's just futile. So those calls I find are for me, the best calls to do.
Yeah.
They keep me busy. They actually get my mind working.
Mm.
They force me to practice what I've learned in school, right?
Yeah. So I have a question, because something you said made me think of something where you were talking about kind of, do we keep resuscitating? Now, as a nurse, right, we know code statuses. We know, do we resuscitate versus not resuscitating?
Yeah.
When you're out on a call, do you just have to resuscitate for everybody? Like,
it's an automatic resuscitation unless there's paperwork that somehow happens to fly out of a car and land on my lap and say, whoa, this guy has a DNR. This lady has a DNR.
Yeah.
But in those situations, nobody's expecting to be injured. No one's expecting to be lifeless, right?
Yeah,
so it's just, it's call. And again, it's one of those calls you make to the doctor, the base hospital, and just determine like, hey, this is what I got for you. Like, is it worth continuing or should we transport? Like, and again, we're taught these are certain parameters that we have to follow. So we make that call when these parameters are met.
yeah.
But if they're not, then it's a full resuscitation effort. Take them to the hospital closest.
Yeah, right.
And up there, the closest hospital has been, sometimes an hour away.
Holy shit.
Oh yeah, I remember doing a cardiac arrest. We were probably 45 minutes away, and this is with, I was precepting at the time as an EMT. Like I just got on, so I'm riding third person. On a normal drive, it's about an hour and 15.
Holy shit.
The person who was driving the truck that day made it in 45. Cardiac arrest, 45, right? The closest hospital to that dude was a block away. And they had to wait for us. We were the closest unit, 45 minutes away.
Oh my God.
Yeah, so those are the things that was hard. Like, they were really hard and difficult for me to kind of wrap my head around up there. Because you got somebody who's dying.
Yeah.
Right.
And you're the closest 45-minute unit away. And that's flying down the road, right?
That's crazy.
And again, the weirdest thing is the hospital was 1 block away. So could he have gotten cardiac meds? Sure. They don't have ACPs up there.
Yeah.
So, you know what I mean? So it's one of those things like, could it have been different if, transport was closer?
Right.
Would it make sense to have like an EMT unit that's specifically located in the hospital, just on standby at all times for situations like that?
No, because it wouldn't matter, right? Bases are bases. They're situated in high, community areas where, there's a good population. Up there, it's so spread out, right?
Yeah.
So where we're at, it's a high populated area, and then between each location, it's just road. It's just
like that hospital location would never be called in theory.
Yeah.
Or like once a week,
Yeah.
and then you're just sitting there and
essentially, right? Yeah.
and just like
That would just
using
be
up
considered.
resources.
You're better off. That would just be considered a base,
Yeah.
right? At the end of the day, which would work, but it wouldn't make sense for EMS to come right out of Met Hospital or OC Hospital and whatnot, right? So,
Yeah.
But there's obviously significant bases close to it, so it's the same premise, right? And again, they calculate things based on call volume. Where's the calls coming from? Where can they add a base? During summer they did have like a remote base up there.
Oh yeah.
Near Sable Beach.
Okay.
Right? Because drownings, all that stuff. So
Yeah.
it did work for them, but during the winter, I think they stopped that because tourists are gone. So
Yeah, that's
there
right.
was no
Just
point
going
in
up
having
there.
them. Yeah.
Yeah.
Right?
Wow, that's crazy.
What was one of the silliest calls that you've ever gotten? Like, why are you
All
calling?
the time, probably.
Where do I start? Where do I begin? Just the other day, silly calls. I've had people call for tooth infection.
Get the fuck out of here.
I'm not even joking. Tooth infection.
Oh my
Yeah.
goodness.
And again, these are the calls where you're like, maybe it's gonna be something. Maybe this person's really sick. No.
Yeah.
"Hi, I've had a tooth infection. What should I do?" And I'm
What?
like, what do you want me to do?
Way off the Skittles.
Yeah, you know what I mean. It's hurting, and like again, we can only do so much as an EMT in terms of like vital monitoring, right?
Right.
People like that, we can search for infection. We can kind of we have our protocols and parameters of like what could this be an infection? Maybe. Could they be septic? Maybe. Right.
Right.
And those are things sometimes you do manage to catch.
Yeah.
But there's other times where it's like just a tooth infection. Yeah, my face hurts.
Yeah.
So we're going there, right?
Yeah.
And again, these calls where people are calling, it's like, yeah, my face hurts. It's numb. Instantly, it's like, oh,
We gotta go.
stroke.
Yeah.
Code 4.
Yeah.
It's like, no, we show up and it's tooth infection. It's like, what should I do? It's like, it's 3 a.m. for some reason. It's bothered people at 3 a.m. the most.
Yeah,
right?
I can see that.
My toe hurts today at 3 a.m. Oh my God, what can I do? What should I do?
Ain't that the truth?
And it's just, honestly, those are serious calls. I've had, I think I've had 3 of those calls where it's just, my tooth hurts. Nobody's going to see me. Should I go to the hospital? I'm like, you need a dentist, man. There's nothing really they're gonna do.
Yeah.
And it depends, right? Too sometimes it's a drug seeking thing. Sometimes we don't know. We can't just assume. So it's one of those things. Again, educate. Like, yeah, we can take you in if you want. I don't know what 100% the hospital is gonna do, or what the doctor or the physician that day who's on is gonna choose to do. Everybody has a different practice.
Yeah.
Right. So they could just kind of be like, here's some pain meds, or wait to see a dentist, or you know what I mean. And sometimes it's on a Saturday, Sunday. Nobody's open. So
Yeah, that's right.
that's the problem with the system, right? It's like everything closes.
So when you do get, I guess, people that are, or that you identify as drug seeking, what do you do? Like if they come and
And the thing is, we can't identify them as drug seekers.
Right.
We can only identify the situation as, could this be drug seeking? Sure. But again, we're nobody in terms of like labeling that person as 100% a drug seeker. That I think happens in just a personal bias. If you see that person several times, right? You see that person, for armpit pain.
Yeah,
and like they've one
asking
time
for Dilaudid.
One time they got
Hit me with the
Dilaudid,
fentanyl. This hurts.
and sometimes you get that. Sometimes you'll get like, no, I need the good stuff, because we have 2 different types of paramedics, right? We have a PCP, ACP.
Oh yeah.
ACPs carry the higher form of medication.
I didn't know that.
Do they always work together or no?
A PCP, ACP works together. Yeah.
Right. Okay.
But the ACP unit or the truck is considered an ACP truck, so it's a higher level medic.
I got
right?
you.
Who can they can perform, an intubation. They can perform higher narcotic medication for pain, and some people understand that, and some people are like,
Wow.
no, I want that other medic. He gave me some good stuff, and so that's when you kind of put the puzzle pieces together. But you still gotta treat that person as a person, somebody who's in a medical emergency. Like,
Sure.
yeah, pain is subjective. And I
That's right.
honestly, I hate the
You
fact
learn
that
that in
it is
nursing too.
subjective,
Yeah.
but it is.
Yeah.
Pain
Just
is what
like
the
guy
patient
that you
says it is.
mentioned,
Yeah.
something's wrong with my leg. Any other person could have been like, my leg feels like it's coming off, and then it would have been a whole different situation. Maybe you saved the leg versus the guy who's like, it hurts, but you know what I mean? So I understand it's subjective, but yeah, you kind of see those people out there, and it's a more repetitive thing.
Yeah.
So if you see them more often, you're seeing the same person like, I want to go to the hospital for pain medication. Then you're like, possibly, right?
Yeah.
But we can never just be like, yeah, this is a drug seeker. Yeah, this guy, you know what I mean?
Yeah.
It's not us to paint that for them.
Absolutely.
Because then those are the biases that go to the hospital. And then, the nurses and the triage people are just like, oh, this person just wants.
Yeah, you're
and
right.
I try not to do that. Again,
you're absolutely right.
Those are one of the bridges between EMT and nurses, where it's like you try to keep them separate, but at the same time, I also know like maybe this is how a nurse is going to perceive this problem.
Right.
So I have to paint it in a way where this person gets
More
the
subjective.
best, highest level of care that they can.
Or objective, sorry.
Right? Yeah.
Yeah.
So that this person is still treated as a person.
Absolutely.
Right? But again, what happens after we drop them off,
That's out of your hands.
it's up to them. It's up to the hospital, right?
So you said ACP?
Yeah, so it's advanced care paramedic. So we're
Advanced-
primary
okay.
care paramedics. Like that's what I am, primary care paramedic.
Right.
And you have advanced care paramedic, which is additional education.
Do they come in different vehicles
Nope,
or
same vehicle? It's
Okay.
just that truck that day is labeled, an ACP. So it's a higher form medic. That's all, right? So
So when you finish paramedic school, what other education goes in?
it goes.
becoming
It's
an ACP?
another year, at a college up either in London. I think I always forget what schools host it, but
Yeah.
I believe Fanshawe. I
Okay.
can't be 100% sure. But yeah, you would go up, essentially do a year of schooling. So I think it's like half semester schooling,
Yeah.
and then a couple hours in the hospital, and then a couple hours out in the field.
Wow.
You do your testing, like your written,
Mm.
and then you do your consolidation period.
Wow.
So kind of almost like nursing, but not really.
So as an ACP, do you also get more an hour or no?
Yeah, there is a small pay increase,
Yeah.
which some will argue is not
Worth it.
not a big difference, right?
Yeah.
But again, they do get paid. But is it worth like somebody like myself going up and getting that? With the education that I have and all the stuff that I've already been through,
Yeah.
for me it wouldn't be worth it.
Yeah,
'Cause
right.
Right now that they're saying that there's going to be a change in the care that we can provide.
Okay.
So it's almost not worth making that investment and transition. But it's always always up in the air.
Yeah.
Maybe not. So
Do you feel like in a way, and this could be yes or no, but in a way that going through nursing school, maybe did you feel like it helped you as an EMT a little bit? Like, do you feel like
I found, like I said, that the higher education and just kind of now understanding what certain populations in our community are facing or dealing with.
Yeah.
Especially the people who've gone to the hospital. Yeah, I was admitted 2 weeks ago. Well, why were you admitted 2 weeks ago? What did they do for you?
Yeah.
And kind of now understanding what they had done and why they had it done makes a big difference, because then it's like, okay, well, what are you not doing?
Yeah.
Right? So that's kind of where it helps me, right? Where if somebody calls me and they're like, I was just admitted, they told me to do this, they told me to do that. I'm like, well, are you doing it? Well, no.
Yeah.
It's like, well, then you should do it.
Yeah,
right?
yeah.
But again, it's like, where's the disconnect?
Yeah.
Right? Was that nurse strong enough to educate the patient? Did
Right.
they really educate the patient? Or did
Right.
they just hand them a piece of paper and say, read this
That's right.
to educate yourself, right?
Yeah.
So I took that into my preceptorship,
Yeah.
and I was like, hey, I'm going to read this with you. We're going to go through this.
Yeah.
You're going to talk back to me about it. You're going to have a level of understanding.
Yeah.
And in my head, I'm like, if I see you, I'm going to be like, are you
Here we
doing
go.
these things that I told you?
Go get your paperwork.
Yeah, go get that. Are you doing this? No, I got lost. I'm like,
Yeah,
well,
yeah.
then. You
Yeah.
see where the problem is, right? And that's
Yeah.
where that bridge comes in, where it's like, okay, I kind of understand now. If they're telling me something, I understand what the hospital's doing,
Yeah.
what they were attempting to do, and obviously if it worked or not,
Right.
from my perspective. But as an EMT, again, I just get my base set of vitals. Are they doing well? Are they not doing well?
Yeah.
Is this an emergency? Do we transport fast or do we transport slow? Right?
Yeah.
But at the end of the day, it's their decision to go. So that's kind of where that really helped me with the nursing. That knowledge is just increased. That's all. So,
Yeah. Okay, last EMT question. And what was I gonna ask? Have you in the hospital how we have frequent flyers? You guys have
Yep.
frequent callers.
Oh,
ones that just call.
all the
for
time,
sure.
man, all the time.
Yeah.
Like I said, it's the drug overdoses. So it's the same person just tipping the scale and trying to push that button on what they can get high off of, or
For sure.
and again, sometimes it's not their fault. Sometimes it is an addiction. I get it, I understand, but sometimes whoever's dealing it to them or wherever they're getting from or whatever it's laced with, sometimes they just don't know.
Yeah.
Right? They could be hitting the same dose all the time, but somebody laced it.
Yeah.
I don't know the drug world. I don't know how it works. All I know is I see it. I see the effects of it, and it's tough, man. Because like I said, we get the same people. Sometimes we get the same people just wanting to go in for a sandwich.
Yeah.
I think just the other night, same guy calls us, armpit pain, and we show up saying, we get him to say one thing, not get him to say one thing, but I'm like, what's the problem? Oh, it's this. It's like, okay, you went to the hospital for that. I know because I brought you. Did they do anything? No. Okay. So what do you want to go to the hospital for? On my armpit. And I'm like, that's been the same problem you've had for a year, brother. Like,
that's
but
funny.
hey, we take them.
Yeah.
They want to get it checked. And those are the people, the frequent flyers are like, you know what they want,
Yeah.
right? It's like a snack. They're homeless or
That's
they're
right.
not doing well in the street. And you just help them out. And
Or some of them are just lonely too. I feel like a lot of elderly patients are calling 911 just
Absolutely.
because they're lonely.
Absolutely.
To have a
surprised.
conversation.
Oh, yeah. We have one patient who calls a lot, and they honestly they just want to make friends at the hospital.
Yeah.
And it's a psych thing, right? At the end of the day, it's like, why do you want to go to the hospital?
Yeah.
Well, I like to meet new people. And it's like, this is not the way to do it.
Yeah.
But that's the only people who will talk to them, right?
Yeah.
They get that communication, that caring communication and
Therapeutic.
attention,
Yeah.
for the most part, from nurses, right? Especially if there's new nurses, they hope to always run into a new nurse who's like, oh, what can I do for you? And then you get in, they run into the old nurses or the people who've seen them before. It's like waiting room. Right? And then it's like they react, and it's we get those frequent flyers a lot.
For sure.
Those are the calls I think that kind of burn out EMT individuals for the most part. If you're in a certain area and it's the same call, same person, same issue, and then again from the nursing perspective, it's like what can we do?
Yeah.
As in the Canadian nursing system, like what is there to do? A lot of these people with mental health, mental illness, they go up, they get checked, and they get discharged sometimes that same day, and it's like what is not being done?
Yeah.
And psych is not my thing. Like I don't plan to do psych. I don't want to do psych.
Yeah.
The people who are a gift from God to be doing that stuff and dealing with those individuals.
Yeah.
Because I know I couldn't.
Yeah.
But again, what's missing there? Is it the nursing? Is it the doctors? Is it just the system itself? Like what is crumbling that is just putting these people in and out, in and out? And we get those calls where people are like, they're distressed, they're in crisis, and they want to go to the hospital, but at the end of the day, they're yelling at me saying they're not going to do anything.
Yeah.
I'm like, I just drive. I just drive the bus, man. I just take you. This is where we need to go.
Yeah.
Maybe it's different this time. And I try to vouch for, the healthcare system all the time where it's, maybe something will change. Maybe somebody else will do something different for you. I'm not sure.
Yeah.
Right? When it goes to that level, if I'm not exposed to it, I have no idea.
Yeah, right.
It's however they do. But we see them the next day and it's like, I was discharged. I'm like, okay, well, let's go back.
Yeah.
We try our best to kind of connect those people with different resources in the community because we do have those outlets, I guess, for us to share with them.
Yeah.
But a lot of them have already gone through it.
Yeah,
gone through all the outlets, and it's
right.
I don't know what to do, man.
Yeah.
You know what I mean? At the end of the day, like as long as you're vitally stable, you're healthy, you're okay, and I know your mental state might be off, but this is the only place I can take you.
Yeah.
That can one keep you safe, right, and then one try and do what they need to do, whether it be medication, whether it be just talking to a counselor. I don't know, right? So
yeah,
those are the frequent flyers. But yeah, a lot of it's drug seekers, a lot of it's drug problems, a lot of it's people saying that the hospital did nothing for them, and it's just the problems are getting worse.
So when you guys work, though, are you always in the same region, or do you guys kind of, like, how does it work? It depends,
right? It's coverage. It's coverage basis, right?
Okay.
So if downtown's getting crushed, which is where I work for the most part, right?
Yeah.
Then they'll pull people from the county.
I see.
Right? And then vice versa. If the county's getting crushed, they'll pull people from, the core and push them out to Harrow, push them out to Amherstburg.
Yeah, right.
It's just rotating. It's just making sure that that area in particular has somewhat of an emergency system to go to those calls, right? And it just constantly keeps moving.
Now, this is my last question for EMT, but what do you guys do from an EMT perspective during a code black?
Code black?
Yeah.
Nothing we can do, man.
Yeah.
There's nothing we can do. There's no trucks, or there's no ambulance to do calls.
Yeah.
What it comes down to though is, the supervisor levels come into the hospitals. They try to help navigate and coordinate care with the nurses and the nursing team, the doctors, in terms of, can we put this patient in an offload bed?
Right.
Can this patient go to the waiting room? Can this patient, because sometimes it's a matter of assessment. Sometimes the nurses are just overwhelmed. The doctors are overwhelmed that they can't assess that person.
Yeah.
So then, our supervisors will come in and they'll help with the situation in terms of, what do you got here? What do you got here?
Yeah.
Okay. Relay that to the nurses, kind of get that assessment done a little bit quicker and determine if this person's eligible to go to the waiting room.
Right.
Or go into an offload bed, or, just kind of seek some kind of quick medical attention to get us back out there.
I got you.
But when it's a code black, like it's just nothing we can do. And again, some of the times we're tied up with silly calls, man. Sometimes we're tied up with a ton of pain. right? We still have to assess, we still have to document, we still have to educate that patient, and we still have to determine if they want to go for toe pain.
Yeah.
If they want to go for a toothache.
So what happens if, let's say, you are on a call like that, like whatever it may be, toe pain, armpit, like something that I think even in the moment you've identified as
Not emergent.
and then an emergency call comes in, but there aren't very many people available, or we're like approaching that code black status.
Yeah.
Like, what do you do in that?
You just make note of it, man. Sometimes you're talking to the patient, you kind of hear it, like, hey, we're in red status, we got 2 trucks left.
Yeah.
Or, hey, we're in black status, we have 0 trucks. You're looking at your patient like, okay, we got to make a decision. Do you want to go? Do you not want to go? Sometimes you can gauge where this person's going to go at the end of the day.
Yeah.
Like I said, if it's non-emergent, everything's perfectly fine. The story is painted as best as the patient can offer it to me, and in my assessment, like I've determined, like this person's not dying.
Yeah.
They don't need something right now.
Yeah.
But they want to go. I know that chances are they might be in the waiting room. So it's kind of one of those things. All right, if you want to go, let's
go.
move.
Yeah.
We've done what we can do here, and all we can do here.
Yeah.
Get them in,
go.
get them assessed, get moved, get back out, right? Yeah. And it's just, again, that's something that all paramedics have to kind of be cognizant of while they're doing calls.
Yeah.
Sometimes calls just take a little bit longer than normal, right?
Yeah.
We still got to do paperwork even for the refusals. Even people who don't want to go, we still have to do quick paperwork. But for the most part, we're really good at, making that coverage.
Yeah, I got you.
And then they have things in place where it's like, hey, as soon as you clear, let me know we got another call.
Yeah.
Right? But then that other call sometimes happens to be nothing.
Yeah.
Right?
Yeah.
Some people know the system. Some people know, hey,
the
That is
keywords
true.
they gotta
exactly.
say.
Some people know the keywords. We're flying. We show up, and they are cool as a cucumber.
Yeah.
Yeah, I just knew it would get you here. So it's
Yeah,
like,
for sure.
They know their ABCs.
I know, they know.
I know their ABCs, and
Yeah.
it's like they sometimes abuse it, and there's nothing we can do. It's just it's a continuous thing, right? It's again education.
Yeah.
All we can do is just educate. So
Yeah, you're right.
So now let's rotate over to nursing school. You went to St. Clair, or
I did the 2 years in Chatham,
Collab.
Okay.
St. Clair, the collab, and then 2 years at university.
okay, how was that? How was that transition from being at Chatham then to the university? It's
You know
like
what?
Small pond to the big ocean.
And that's what
you know
I think it was. I think for those who are wanting to go and want that like that higher level learning and that attention from like professors and kind of that hands-on skill, go to the smaller school. Right? Like as much as I hated taking that hour drive sometimes
sure.
during the winter, during crappy shitty weather, things moved quicker. Right, you got the attention of the professors a little bit better. You got more, you got better education, I guess, in a sense.
Yeah, because smaller class sizes.
Quicker information. Whereas I found that with the university, it took forever to get a response.
For sure.
The response wasn't quick enough. Even if I wanted a response before the test, they always had the rules and regulations where it's like, don't bother me a day before the test.
Yeah.
Right, but it's like, while I'm studying. Now I have a question. I don't know what to tell you, right?
Yeah.
Where I found like the Chatham, professors were a little bit quicker to respond as well. They still had that kind of rule, but some of them would just be like, they're not getting such an influx of emails that like they see an email pop up, they're like, all right, let's help them out, right?
Yeah,
so you kind of got that good rapport with them, and for the most part, like again, the smaller classes did help,
for sure.
right? You got more attention. I just found it to be more hands-on, especially. I know a lot of people always say that the college is more hands-on, and it is.
That's what I've heard too.
Yeah.
Yeah.
Because I remember doing some courses and some lab stuff at the university, and it was quick.
Yeah.
It wasn't as hands-on.
Right.
It's more of like, do what you want to do.
Right.
Whereas in Chatham, they actually had you do it. And then they're like, well, I need
And
to
they're
see
watching
you.
you.
Yes.
Yes.
I need to see you do it. Make sure you do it a couple times. Do you feel comfortable? Cool. Where it's here, it's like, all right, go on, do your thing. Nobody's watching you. Nobody's really gauging if you're doing anything. It's like, well, leave when you feel comfortable. And it's like, and again, it's up to the student, right? It's not just all on the professor. They got thousands of people there. They got hundreds of people there. So again, it is our role to delve in as much as we want to learn. But at the end of the day, it's always nice to have that teacher kind of push you, right?
Yeah.
Right.
So now that you're done school, if you could choose like a specialty, have you identified yet where you think you'd want to be?
I think with being a paramedic, it's more cardiac related specialty, right? So I'm trying to do something where it's more cardiac related. So at first I wasn't sure because my preceptorship took, place on your floor there.
Yeah.
Which was kind of half and half, right? I think it was ortho.
Yeah, it is.
Ortho
You get, and then you get
med.
like all types of surgeries except for like neuro.
Yeah, and like general med, right?
Yeah.
Which was like, it was good. It's a good, honestly, if anybody goes to your floor, it's a great floor to learn. I think
it's a great floor for like upgrading skills, learning, educating. Yep. It's a good like teaching unit, I think.
I think I got to see a lot. I got to see tubes, I got to see drains, I got to see catheter, Foley's, all that stuff, right? Good floor though.
Yeah.
At the end of the day, just I don't even know.
You think you would do like because in the States they have a lot of like ICUs. Would you do like a CV ICU, like a
So
cardiovascular?
right now I'm waiting for a response for the CVS.
Oh yeah,
right? So cardiovascular surgery.
Yeah.
I have a couple friends who work in the ICU and said that that's a good unit to start.
Yeah.
Like your career on, right? Nice slow pace for the most part, I guess. But based on how they describe it, it seems like it's a good place to start and kind of good learning place to start. I just don't see my interest in anything else, to be honest. Like gen med, like it's not for me. That slow pace kind of medication.
You know what I expected you to say? I kind of expected you to say the ED because you're already
no,
like,
man.
I was thinking there already.
You see the ED enough, dude? You're just like, no. Again, why? I get the frequent callers.
Yeah.
ED gets the frequent callers.
You're absolutely right.
They see the same people.
Well, literally, because they go from you right to the ED. Yeah.
And then, I finish this shift here and I go back and they're still there. Now I gotta watch them. Give them, and then I gotta go back to my shift. I pick them up again. I couldn't do it, man. I couldn't do it. People, even the people who've worked in ED in the States, they're like, it's just same thing, man.
Yeah.
People calling for these things, it's the same thing, and I'm like, I don't want that. I want to feel more important in terms of like using my head, using my brain instead of just kind of putting a patch on things and going from there, right? Not to say that ED is just patching stuff.
No,
but
I
sometimes
understand
it
what you're
happens,
saying.
right?
It is,
Whereas like that more long-term care with, a more importance role in medication and skills and, kind of really using your head to make sure that this patient remains alive, stays alive, and then goes home safely is kind of where I want to be.
Well, that is kind of the point of the ED is to get someone stable and like send them either to the unit or if they should be going home, send them home, So, and if they go to the unit, you typically don't see that progression of them improving.
But that's the thing is, I love the word that you use, stable. That's what EDs are for, but I don't find that we use them to stabilize patients.
Absolutely.
We use them as a clinic, right?
Yeah.
Most people are using them as a clinic.
I 100% agree.
There are clinics, and people just refuse to use them because they're like, oh, the wait's longer. Or again, they're under the notion that if they go with us, it's quicker. If they go to the ED, it's quicker. And
That's
it's like, it's not.
That's
right. But yeah, kind of that word stable, like I wish that's how it was. I wish it was a stabilizing situation, and then that's where the determination of floor or home. Yeah. But then, again, it gets so backed up with not stabilizing and more just like, what else do they need?
Yeah.
Before they go home.
Yeah.
Yeah, that's kind of where I want to go. Honestly, when I saw an OB posting, I was like, maybe.
Yeah.
Because I do like pediatrics. I do, but I'm not strong enough in them yet.
Okay. Could you see yourself doing peds?
Having a daughter now and all that, it kind of makes you realize, like, maybe my skills and knowledge would be best there. And I do, for me, it's not so much like what the pediatrics have to offer in terms of, how they take care of children. Yeah. But it's more of like the interaction with children, right? Like for me, it's the progression of how children grow up and how, like, what their situations are and how they go through life. That kind of intrigues me with pediatrics. Yeah. But also to be able to help them would be fantastic. But I'm not strong enough in that yet. Yeah. Maybe one day I would do peds, but
experience is how you get stronger. You just go do it.
Yeah. And honestly, seeing my wife give birth, it's pretty phenomenal, right? So to do OB would be great, but they say there's not a lot of male OB nurses, which I kind of think is silly, but I get it. I kind of do.
I get it.
I get it.
There's a lot of bias in that.
He's told the story where husbands do not want him in the room.
Yeah, I've had men that did verbally say, "Yeah, I don't want this guy in my room with my wife."
And how do you deal with that? You know what I mean? Like,
Bye. Can't do my journal, miss.
He was a student.
Can't do my journal. Can't do my.
I wasn't allowed, you know.
You know what I mean?
Yeah.
So I just go to the nursing station and do what I do.
Yeah.
I mean, I can't really do much.
And that's just puts such a hassle and strain on like the other nurses, and they're like, you know, it's like again another one.
Yeah.
Really, like you're a nurse, like you're a professional.
Yeah.
And, like I think people have to understand that so that changes.
Absolutely.
Right, so that males who want to be OB nurses can be in there.
Absolutely.
'Cause I think having a strong male presence in there is also important. Right?
100%.
And I get
agree.
it; they're caring, but to be honest, I find that males are more service oriented. Right, we're just kind of more caring. We understand what people want to hear, what they want to hear, or what they want to see. So I think it would just be good for us to be in those kind of fields.
And you know what I'm surprised by? I'm actually surprised more people don't want male OB nurses because most of the OBs are males. So all these people that
Right, the
care
doctors,
so
yeah.
much about a male nurse being in the room, like, dude, the dude putting his hand in your wife's vagina is a man.
Facts.
Like, what am I doing? I'm just here to catch, G.
Yeah.
What the fuck?
But again, they're doctors,
Yeah.
right? They're physicians. They know what they're higher level medication. They know what they're doing.
Yeah.
And some people kind of disrespect nurses like that, and I hate it.
Yeah.
Right? I hate when people do disrespect you guys like that. I mean, I am an RN. I'm planning to get that disrespect come my way, but
Yeah.
you know, it's one of those things where it's like, you know, stand up for yourself, I guess. And
Yeah.
So this is a hot take, and from this take we're going to transition into the NCLEX. I feel as if with OB and males, if you're a male and you're about to write the NCLEX, I feel as if they should take out the OB questions for males, because they're not gonna hire us.
Yeah, I mean, but the hope is that this will change.
Yes.
too,
It's
right?
not gonna
You
change.
can't- you
It's
can't
not gonna
take it out.
change.
Because this is my thing. Like, not that I've been to the I have 2 kids, but both times, all I see for the most part, I've only ever seen one female OB. Even though we have more in Windsor,
Right.
I've only ever seen one female OB. The rest of them have been guys.
Really.
actually, you know what? Our guy wasn't. No, I think he was busy or something. I can't remember what the situation. We had a male OB,
Yeah,
and it ended up being a female OB.
yeah. It's whoever's
Which-
on call.
Which
Whoever's
that-
on call is
yeah,
delivering your baby.
So it was kind of like, man,
Yeah.
like we had this guy care for us the entire time. Fantastic dude. He's on his way to retirement. Like he's like
Yeah.
a couple, like probably retired now.
Yeah,
But the lady who took over, who was going to be the OB that day, fantastic as well. Like she was phenomenal.
yeah.
Very chill.
What was her name?
Oh, man, I couldn't.
Chinese
remember.
lady?
No.
Oh, okay, never mind. I was gonna say she's the number 1 OB in all of Windsor.
Wow.
Yeah,
Oh, which
Dr.
one?
Chen.
Oh, okay,
Chan.
no.
Shout out Dr. Chan.
Yeah,
She did my son's circumcision.
Shout outs, respect.
Shout out. Yeah,
Fantastic
you did
job.
a fantastic job.
Fantastic
It was a
work.
little too
Yeah.
expensive, but you did a great job.
That's new too, that expense, eh?
Yeah,
oh,
bro.
funny story about that.
Yeah.
So this is why I don't like this, like the billing of our healthcare system.
Yeah.
I have a daughter, okay?
Yeah.
I got a $250 circumcision bill. Come to my house. I'm like, excuse me.
Yeah. Wrong house.
I have a daughter. Oh, we're so sorry. They got rid of the bill. I'm like, you just sending these things out in hopes
That's
that you
crazy.
get money? Like,
I should have.
what?
That works. I'm gonna use that next
Right?
time.
That's what I'm saying.
No, for real.
Yeah, girl. Why'd you send me this?
Because honestly, I don't even think they did a background check. No,
That's
nothing, bro.
hilarious.
I didn't hear the lady say, one moment,
Yeah,
click,
yeah.
female. No, she's like, oh, I'm so sorry. And I'm like,
Oh,
all right.
I'm gonna use that one.
Yeah, I bet. Like,
I'm gonna use that.
That is an issue in healthcare. I feel like they just drop off a lot of like expenses, unknown expenses.
Oh, for sure.
Multiple IV insertions,
Oh, for sure.
X-rays, CAT scans, and you just went in there to get what? Tylenol because you had a migraine or something?
yeah.
That's insane. That is a problem.
Okay, so now to transition to the NCLEX though. Did you question? If you don't want to answer, I know it's still early. Did you pass the first time?
Yeah.
Did you?
Yeah.
Damn,
But I was
he's-
shitting my pants,
He's
man.
smarter than you, bro.
Yeah.
I'm just playing.
Listen, bro.
I'm
Hey,
playing.
I was shitting myself. It's
Yeah.
that same notion that everybody's like, you leave and you're just like,
I
fuck.
failed. Yeah.
I literally, I called my wife. I'm like, yo, I'm packing my shit up and just doing something else. I can't do this anymore.
Yeah.
And like, it's awful, man. You felt like shit.
Yeah.
But
How many
results-
questions did you have to do? Do you remember?
I did the 150.
150.
Yeah.
So here's
Alright.
the thing: when I did it, like, and this is why I said we're gonna skip into the NCLEX. For me, I had multiple OB questions that came sporadically, like back to back to
Yeah.
back. So I'm like, shit. I'm not gonna pass this because I did not study that aspect.
It was
all.
strong. It was strong OB questions. Even
you
for
too?
me,
Very.
it was strong OB, strong peds, and again, I'm lucky to have really enjoyed the pediatric portion of like, you know, one of our courses there,
Yeah.
professional nursing, and I was like, it interested me the most, right? Just kind of the peds development, how they go through stages of life,
Yeah.
the OB process, just having a baby and all that stuff, kind of like
That'll be cool.
okay,
You'll
right?
see
Yeah.
when you start to see
Yeah.
that in your own kids.
Yeah.
It's cool.
Because I also saw like the transition, the heart rate, and like the rhythm strips and all that, right? So
Yeah.
like, okay, I'm trying to remember this, and I wrote my NCLEX, and it kind of did help.
Yeah.
But for some reason, mine was strong on OB and peds.
Yeah.
And I was like, damn.
Yeah, but the NCLEX is, I can't remember what they call it. The
It's like
word
a
isn't
sta-
comprehensive.
Standardized? No, is it standardized?
No, it's not standardized. It's kind of like where it's tracking like how fast you're answering questions, what questions you're answering right, and all these things. Comprehensive is not the
I know
word.
what
It's not
I know what
standardized.
you're,
There's a
you're
word
talking
for it.
about. Yeah.
Yeah, so it tracks all that.
Yeah,
So
it's
if
like-
you guys had those, maybe it's like, oh, it seems like you're thinking a little harder on these OB questions.
And it's
Yeah.
true.
You know?
Yeah, because it's funny enough though, because like while I'm writing it, I'm like, all right, it's supposed to stop at like 80, I think, if you're doing well, right? Or something.
Well, I think
like that.
the earliest you can stop
85.
is 75.
Yeah,
The earliest.
75.
Is it 75 or 85?
Is 75 is the earliest.
It might have changed.
Unless it's changed.
I think
Unless it's
it was
changed.
85 this year.
Okay.
And so I'm writing, I'm like, 85, here we go, one last question, I feel good. And it was like, nah, keep going.
Keep
I'm
going.
Yeah.
like, fuck, dude.
Keep going.
I took a break, instantly regret taking that break because I went to the washroom, just simple, I'm like, shake it off, all right.
Yeah.
Come back, none of the words on the screen made sense when I got back. I'm just, bro, they became one word answers.
Yeah.
What is this? And I'm just like, what is this? Like, man, I'm sitting there thinking, I'm like, and it's like, it was all started, it became one word questions. Like,
Yeah.
what is this? How do you deal with this? What is this? And I'm like, did I fuck up? Like,
Yeah,
are they like, am I stupid? And they're just trying to give me marks?
Am I in the right seat?
Yeah. I'm like, is this my computer?
Am I in the right room?
I had scenarios, and now I have
85
one word
questions and
Yeah.
scenarios. Yeah.
And I'm like, and then again, it would start to go back up to like scenarios, and then
Yeah.
I'd go back to those one. I'm like, I feel like I was hovering, so that's why I felt like shit when I got done, because I'm like, I was hovering. Like after the 85, I was just hovering.
Yeah.
Hard questions, easy questions, hard questions, and what was relatively supposed to be easy was not.
Yeah.
But I think that's where it was supposed to try and be easy for the person to kind of boost up a little bit.
Yeah.
But I was just hovering the entire time. So when I left, I was like,
I could see why you felt that way when you left.
yeah, it was tough, man. And like,
Yeah.
luckily they gave you a response pretty quick.
Yeah, that's
and
right.
that method that used to work, where it's like you would try and sign up or something like that.
Yeah, yeah.
It's not worth doing, but like I didn't want to try it, and I kept reading like it's not as accurate anymore.
Yeah.
Right.
Oh, to see if you passed the test?
Yes.
Yeah, I did
Yeah,
that.
because I looked at my sister did that.
Yeah.
And unfortunately she didn't, but she's a great nurse now, and
Yeah.
she's out in Washington. But
There you
Yeah,
go.
like that first time I wrote the NCLEX, it was harder than an entry exam into Harvard. I'm not even gonna lie.
come on, did you write the entry exam to Harvard?
No, but I read stuff on Reddit.
I can only believe.
Leveled out. But I mean, yeah, it was just difficult. Once I got those OB questions, I was toast.
Yeah.
So for you, I've heard that they've transitioned the NCLEX to different style questions like select all that apply. Back then, I didn't have select all that apply.
Really?
Yeah.
I thought that's how it's always been.
No,
No, they change it every few years.
I don't think, or maybe I just didn't get
Like
select
they have
all
the
that
multiple
apply.
multiples now, but the way that the system works,
Multiple.
Yeah.
What's a multiple?
multiple is
Like it's multiple choice, and you could choose select all
yeah.
that apply.
Yeah, so it's
Yeah.
like here's a question. Is it A, B, C? Is it B, C, D? Is it B, C, D, E?
yeah, I see
So
what you're
multiple
saying.
multiples, but it could also be
Just
it
A.
could be
just one.
one
Yeah,
A,
just
B,
A.
and it could be 3 C, D, E,
Yeah.
but it's not like 2 E or 2 F, whatever, right? So you could have two answers that are right with multiple responses in them,
I see.
right?
That's
So if
nuts.
there's four like answers, 2 of them are
See, that would
correct
fuck
with
me up.
multiples in there.
That would fuck me up.
That's where it's like, fuck.
Yeah.
And is it not this? Is it this? I'm like, but that's how it got to that level of like difficulty.
Yeah.
But that's what we dealt with. That's what we're dealing with.
Did
right?
they have like matching audio?
They had
implement
zero
those?
audio, but they had the matching stuff. They had fill in the blank every once in a while. But honestly,
Fill
it
in
was-
the blank.
yeah, fill in the blank, fill in the response
Where did you write your NCLEX?
in the States.
You did
I wrote
write
it
in
in
the
Michigan,
States.
yeah,
Yeah.
because it was the closest
compared to London, right?
Compared to London, which just saves me time, but it also gave me the chance to kind of study, right? And I did the UWorld thing, which I found did really help.
Yeah.
But again, that assessment was still saying I was borderline, not doing well, doing well. Like I was good. Sometimes I was really great. Other times I was real shit. So I was, again, hovering, which made sense when I did take the NCLEX. I was like, yeah, I guess, the way I studied is kind of similar to the way this is turning out.
Yeah.
But the NCLEX said I won, or the UWorld said I did well. So I'm like, all right.
Yeah.
But we made it. So we did it on the first try. And it's, again, no fault to anybody who fucks up the first time, man. Just don't quit.
No, they're stupid, bro.
Yeah, you're gonna feel like shit at the end of the day, and everybody says it. You'll hear it 100 times, and it's not gonna get through.
You also feel like shit because you hear how so many nurses fail that first time, and then you just really don't know when you walk out of there that you're just like, I probably failed.
Dude, it's the anticipation of the 40-day waiting period too.
Yeah,
you have to wait 40 days to write again. You're like, another 40 days of just like studying, going about your day. And again, if somebody like me just had a kid, now I got to worry about a kid.
Yeah,
I got to worry about a full-time position, pat leave, all this stuff. And I'm just like, that was my biggest worry. I'm like, I can't wait for another 40 days to get this done.
I can see that.
And now everything's postponed 40 days.
Yeah.
Right? So it was one of those situations. That's what freaked me out the most. Not the fact that like maybe I failed. It's just the delay. The delay in getting this shit started.
The potential of having to delay.
Yeah, right? Back then it was rough when I failed, man. And back then when I wrote the NCLEX, we were big on social media, like Facebook, Instagram. So now I'm seeing all my peers posting their results.
Everybody was posting their shit.
Oh, I passed. Like they'll white out their address.
People still do that.
License. They still do that. But back then it was huge.
Nah.
And especially it was like a huge wave of people took the exam at the same time, and a huge wave of people are posting. And you knew who failed because they did not post.
So for me, it was I didn't even post. I'm not the type to post shit like that.
Yeah.
But it was to the point where like people were like, oh, Gina, did you write? Like, we didn't see you
post.
post.
When you writing? Like, yo, I didn't write
See you in 40 days.
Yeah.
See you in 40 days.
So that's what it was.
That's when you respond, I'm writing in 40 days. You're like, why 40? It's like, don't worry about it. It's just scheduled that way.
That's
okay?
right.
40 days from now. All right?
But there's some people that do post or that didn't post, and they post a lot of things like photos and stuff like that, but they didn't post. So it's like, okay, you didn't.
Yeah.
Okay, so back to nursing school. How was your clinical experience? Because you mentioned how you already had in mind what you wanted to or what you want to get into.
Yeah.
With cardiac.
Yeah.
But how was it going through the motions of doing labor and delivery, having a psych rotation, or?
Like I said, I didn't know what I wanted to do.
Oh,
I didn't know what I wanted to do till like recently, to be honest, because I was just like, what? I don't want to do your typical, style, just kind of bedside nursing. Everybody's like, oh, all nursing's bedside nursing. I understand that, but I'm talking about like again, med surg, like just kind of like rotating through people, giving them their medications, making sure that they're healthy enough and their blood pressure is fine enough to go back home.
Yeah, right.
I don't want to do that. I want to do something that's, riskier. Something
like
that's
stimulating your brain.
Something where it's like you got to think like, okay, their pressure's this. You got to put a pump for this. Like they need this high level cardiac med or whatever to just even do the function of the heart needs to do what it needs to do. Yeah. Right. For them to be stabilized, or they're up and down. Like those patients that are like not ICU level, but like they still need some like more close monitoring.
Yeah.
But yeah, ask the question again one more time.
What was the question?
Damn, y'all are crazy.
Oh, yeah. Your clinical experience from first year to fourth year, because I know in Chatham, how's your clinical experience in Chatham in a small town? Then transitioning over to Windsor, being in a bigger.
The thing is with Chatham, right? Like all this nursing stuff was new to me. So, but it being on a smaller scale, where it's like again a smaller hospital. It was all just med surg. Yeah. Right? It was bedside nursing. You got to see everything. But again, those first 2 years, it's so negligible, right? Like you're really not doing much. Yeah. You're doing kind of like, personal, PSW work, which shout out to the PSWs, the fucking real heroes. Yeah. I swear, man. Because we couldn't do what we do if it wasn't for those people just working nonstop. They grind. Yeah. Though if anybody should get a medal for the nursing stuff, they need a raise because those guys were hard.
So funny thing about PSWs, I used to be a PSW while I was in nursing school in the summertime. and there's an acronym for PSWs. PSW stands for piss, shit, and wipe.
Damn.
That's
God damn.
rough, bro.
That's rough, but
Sorry,
no.
PSW.
Shout out to the PSWs
Yeah.
though. But
Damn.
I mean, that's all. That's all I did. Piss, shit, and wipe. I just clean, piss, shit, and wipe. That's it.
That's damn.
But yeah,
Hurts
that's
a little, bro.
crazy.
Like,
but
wow.
you're right. They do
Yeah.
deserve a medal.
But that's what I'm saying. They do that stuff to, like, so we could not do it.
Yeah.
Right.
Right. But like, I feel like they should not. Like, don't get me wrong. Should they get paid well? Yeah.
Yeah.
Get paid more than nurses? No. Like, we did what we needed to do to get
Yeah.
to where we got to get to. But again, in terms of like working hard, like I think those
They do
guys
bust ass.
Those
They do bust ass,
man.
bro.
Yeah.
They bust ass. But yeah, like again, the first 2 years so negligible. Like you're learning what you need to know for the basics of nursing, but it's like you're not retaining much. I found that I didn't retain much because it's like because of the education that I received prior to, like basic vital signs. I'm like, okay, I'm past that. I already did that in school.
Show you how to
like,
do a 2-step blood pressure.
Like, I know how to do. I know how to do IVs. Like I know how to do all that stuff. Like the basic. Like even just like kind of getting an idea of the diagnosis of what this patient is going through. I was already there.
Yeah.
Whereas like my counterparts were just like, what's going on?
Yeah.
Well, excuse me, their oxygen's 91, and it's like, yeah, but they have COPD, they have asthma. That's fairly normal for them. They're not struggling to breathe. They're good.
Yeah.
They would run to their preceptors.
Yeah.
God, they're not breathing.
They're
Like,
desatting.
yeah.
They're gonna die.
Yeah. And I'm just like that, where I'm like, okay, this is boring. Like I'm ready to go, right?
Yeah.
And it's just, and again, doing it every other week, I don't think was consistent enough. Not to try to give these professors and these the system an idea of getting people to go frequently.
Yeah.
'Cause you still got to work your life and do everything, but the first 2 years totally negligible, right?
Yeah.
I still got to see how the system worked and how nurses do their things, but aside from that, it was more observatory than.
See, for those first 2 years, how do you keep yourself stimulated though? I feel
That's
like
the
I'd be like,
problem,
bro. I don't.
I
even
find
wanna
that's the problem with preceptorship is that they need to do more. They need to jump in to do more so that when it comes to fourth year, they're far ahead of where they need to be.
Yeah, but do you feel like that's just for you? Like, don't
No,
forget
I don't think
what
it's
your
just for me.
background is, because a lot of
Yeah.
these kids that do come in, like you said, okay, if you're freaking out over like a 91% oxygen, what are you gonna do if we put you in an ICU? Like,
But that's what I'm saying. They need to get that level of information sooner, understand it sooner, so that when they get to even second year, they're like, that makes sense.
Yeah, but my thing is, you can't understand it unless you really go through it. Like, I feel like what you described of those students, I feel like we all went through it. You know, apart from you, honestly, because you had that like you had
That
such
background.
a crazy. You have to understand, it's your level of experience isn't just at like a med surge like unit level. You're at like almost like an ED emergency level.
Yeah.
So for you to be put into a nursing home your first 2 years, it's just like, dude, come the fuck
And
on.
some of your
agree.
some of your peers are probably coming out of high school.
Right.
These are
100%.
18,
That's what you have to
19 year
think.
olds.
So those kids are like, what the fuck is going
Yeah.
on?
But here's the thing: is I think what creates good nurses is. So I find that like the really smart nurses are shit hands on. There are the occasional, which is fantastic. They're bright. They get it.
Yeah.
Like this is just what they were born to do. But then you have those super bright nurses that I'm just like, they're so scattered brain still, and that they're overthinking stuff.
Yeah.
Right. So it's I think to make the nursing profession strong is to get those students who are super strong, theoretically, and make them hands-on strong.
Yeah.
But that only happens if you give them the opportunity to actually get in on things, right? And I get like, you have to learn a skill before you have to actually do it.
Yeah.
But even then, like the skills were learned so slowly.
Very slowly.
They're like, here, do this. Okay, we'll recap in 3 weeks. It's like, can we do a couple more skills, right? Like at least the skill aspect.
I do feel like that's just part of it is just where I hate to put this like as like an excuse, but where the younger generation is at. Like I feel like if you get inundated with information and you get overwhelmed, what happens? They go and they complain or they have some sort of
that's the
depressive
problem.
issue,
Yeah.
and then Now schools have to accommodate their problems, and that's just kind of where we're at now.
That's a whole
You know?
whole different.
Like, I feel like the way we learned is you just get thrown into the fire, and that's how you learn.
Yeah.
that's how you should be.
And nobody complained.
Yeah,
And you were
nobody.
just like, this is how you learn. This is a rite of passage.
Now everybody has rights.
You know?
Now everybody has rights. You know,
that's how-
everybody gets offended,
Yeah,
and that's
you're
the
right.
problem. It's like, well, they told me to do this, and I had to do this, and I can't do this. It's like, but this is what you have to do as the nursing profession. Like, this is part of it. Well, I can't.
Well, so like I'll give you an example, right? So at the moment, not like at the moment, but recently, on our unit, we had a nurse that was precepting
Yeah.
a student,
Okay.
right? And it was their last preceptorship.
Yeah.
And the student just wasn't getting it. And this girl on my unit is very patient. She is actually a very good nurse,
Yeah.
very patient.
Yeah.
She did everything the right way. But she's also documenting everything that's going on and how this student just isn't getting it.
Mm-hmm.
And she's trying to get her extra help, extra resources. Like, this is what you need to look at for tomorrow because we're going to have the same assignment.
Yeah.
So you want to be ready
Yeah.
tomorrow.
100%.
And so all these things, she's doing everything. And then so when it came time to like hand in the midterm for the student, she was like, honestly, you're not doing well. But this is how you can do well.
Yeah.
But she's held her hand the whole way.
Yeah.
And showed her this is how you can do well the whole way.
Yeah.
Now midterms came along. This was her report. It was like this thing that just blew up because the student took it so poorly.
Yeah.
And here's the thing is that nurse was very open to us as coworkers.
Yeah.
Because for her, it was like, okay, when I'm not around, make sure we're watching her and making sure we're teaching her the right way because she does want her to succeed.
Yeah.
And anyways, she was eventually just like, I just don't think that nursing is the right fit for you because of the extracurriculars that the student was doing. And it just blew up. And then the student was like, well, you were bullying me. You're racist. You're this. You're that. And we were all like, oh, what?
Hell no.
We were like, what? Like,
So she played this girl played the racial card.
oh, bro. And the thing is, it was like, so here's the thing. So now there is, I don't know how much I can talk about it, but there is like an investigation going on because obviously when a student says that, you got to take it seriously.
Yeah.
right?
Bullying and all that
But
stuff and claims.
My thing is because every student has like I don't even know what the word is, but a teacher that watches over them.
Yeah, they're I can't remember what it's called, but our mine was great, by the way.
Yeah.
Shout out to her. She's watching. She's fantastic.
Like a professor essentially.
Yeah.
Like a
Yeah.
professor.
So this nurse is also like talking to her because she's asking questions when she's around.
Yeah.
She's being honest. She's just like, but she's also saying, I think she can do it. Like she just needs to, fall in line type deal. So there was like this big meeting with like the department head, like the chair of nursing.
Oh, come
The
on.
chair, like, because when you're gonna call someone like racist and all this
100%.
stuff, it's now becomes like she said.
Yeah.
But the nurse that works on our unit, bro, wrote this essay because she knew this was coming. She had a feeling that this girl would say some bullshit at the final hour, and she did. But she had written out this like, I think it was like 12 pages, bro.
12
She was so
pages.
thorough, bro. I could actually
for her.
show it. I could show it to you. She sent it to me.
Good for you.
And I was like, oh my God. But it was so thorough because other nurses had concerns.
Yeah.
And she was like, listen, I have a feeling that this girl is going to just say some bullshit.
Yeah.
I want to have this in writing. And I like, if you guys are willing, she didn't put our names, but she put like our initials or whatever.
Yeah.
So she was like, if anybody wants to talk to you guys, are you willing to talk? And we were like, yeah. I had no problem. Anyways, so that was that story. But so she did put my name on her essay because, and this is the craziest thing. So I was working a day shift. They were coming off of a night shift. Okay. And as I'm getting report, I just wasn't thinking, bro. It was so early in the morning. I think I like dropped my kids off at school before I went into work. And
That's early.
yeah. And so we got up at like 5, right?
Yeah.
I was just so tired. And I'm getting report, and I remember looking up and looking down the hall, and beside me is the nurse I work with, giving me report, right? So she's here, and her student's like right where you are, like distance from me, Irvin.
You couldn't see her,
I can see her because I'm taller than both of them.
but you didn't acknowledge that it was her.
I knew it was her. So I looked down the hall, but I'm like looking past them, okay? And I see her student do one of these, and then smoke comes out. I was like, this bitch is vaping.
No.
on the
Come on.
unit.
I thought you were gonna say voodoo or something. Putting a curse on her ass.
Yeah, bro, she was vaping. So, and I just happened to look down the hall because she's talking, giving me a report, but I'm like zoning out because I'm tired. And I look down the hall, and as I'm coming back to my piece of paper, I'm like coming, kind of like
you see
analyzing, and I like saw the smoke, and I didn't say anything in that moment.
Oh, no.
One, in part because I was just exhausted,
Yeah.
and two, like on the side, I bartend every once in a while, and kids these days vape in clubs all the time.
Yeah.
And I don't care about it.
Yeah.
I don't say anything.
No.
They try to, as long as you're trying to hide it, I could care less.
Yeah.
You know? And it was just one of those moments that it was just like desensitized to what I normally do.
Yeah.
And then like 2 days later, I was like, hold up. I was like, I saw that bitch vape.
Dude.
I was like,
insane.
yeah, bro, it
Come
was
on.
crazy.
So, wait, serious question. What flavor did it smell like?
Yo, I don't know. I should have asked her.
Nah, bro.
I mean, that's great.
And this was after everything happened, or this was
So
before?
this is like as things were developing. So this was like, actually, you know, because from almost like day 2, she was like, hey, like,
Yeah.
this is your last preceptorship.
Okay.
Like, I'm not expecting you to take the whole assignment and be nurse of the year, but like, there needs to be some level of like advancement and understanding that she wasn't at yet. And so this was like the day I saw her vape, maybe like day 6 or something.
Okay.
Like, you know what I'm saying?
So not yet there where she claimed what she claimed.
But what was crazy was the reason I guess people believed what I had said was like while she was on the unit, one day a couple times she had like fallen asleep on the unit and her vape fucking fell out of her pocket a couple times. So she's like on the unit with her vape pen.
Nah.
And the nurse was like, yo, stop carrying that around. Like,
Yeah,
you don't need it while
100%.
you're working.
100%.
But on your break, you want to take that shit outside, take it outside. Who the fuck am I to...
Because isn't there no vape, no smoke signs?
Oh, yeah,
all everywhere
absolutely
right
there
now?
is. Yeah.
Because of
But
how
kids,
big it is?
Kids now don't give a fuck.
But I'm
Kids
just
don't
saying,
care.
those are one of those things where that's a suspendable offense. That's
Oh,
like,
100%.
That's like
time.
you lose
100%.
all your credentials.
time.
Like
100%.
you can't be doing that on a unit.
Right.
I just heard of a story of somebody who did that recently on a specific unit, and they got suspended.
Yeah, bro.
Like, what?
Because it's
Like, you're not supposed
now
to
it
be
is
doing
no
that.
different than like smoking out just like in a room, right? You can't be just I know they used to be allowed to smoke in hospitals, but you can't just be doing that no more.
No, that's that's like a criminal.
Because if you're allowed to, I'm gonna set the hookah on the nursing
Right.
station and start
Come
doing my
to
thing.
it.
Get it popping.
Everybody's coming to it after every patient care. Oh,
Like-
man. You know what's crazy about that story? Actually, it kind of reminded me of something. So when you're supposed to, when you start your preceptorship, they still start you easy.
Yeah.
They
Oh,
still
super
start
easy.
you on. Bro, I went straight to 5. I was 5 the entire preceptorship.
Were you? Who were you? You were with Franca?
No, it was Molly.
You were with who? Molly?
Yeah.
Oh, were you?
Yeah,
Oh.
she didn't say nothing.
Oh yeah. No.
Molly
but-
left me hanging
But
with 5.
if she feels like if she sees like you're just taking shit, she'll be like, all right, do your thing, big homie.
And that's what it was though.
Yeah.
And that's what and then I'm like I said, I was talking to like my peers, and they're like they're getting
Nobody
reports,
else.
and they're like, oh, they just have 2. I'm
One
like,
or
I'm
two,
looking
yeah.
at their paper. I'm like, you only have 2 patients today?
Yeah.
It's like, no, that's all I can do. I'm like,
I got
I
5.
got 6. Like they pushed on 6. Like
Yeah.
I'm watching vitals. I'm taking care of 6
Yeah,
patients.
but this is also the difference again in your experience, right?
Yeah.
Like when you
Right.
because you're not like even as an EMT, it's not like you're moving fast.
Yeah.
Like so you get on a unit, you're not just like trotting around like
No.
all these other kids. You're
well, the
moving.
triage assessment's
like-
there as well, right?
Yeah.
The kids don't have that triage system down, whereas I've already learned kind of what's more important, what vitally it should be assessed right now,
Right.
or what patient condition should be assessed.
Right.
So I didn't worry, but like they were like, yeah, you were supposed to start like with like 2,
Yeah.
like because they always say like by 4th year you're supposed to be like 4 or 5 patients.
Sure.
But I'm like, nobody told me that. So I was grinding the entire.
Just
I could have been
sweating.
chilling.
Yeah.
Yeah, I could have been like 1, 2 patients for the
Nah,
first 2 weeks. Nope, just 5 every day. And I was like,
said,
I was exhausted.
Here's the deep end.
Yeah. Oh, I was exhausted, man.
Yeah, I can imagine.
Oh, but it
and
was,
you're
it was
still
fantastic.
were you still working as an EMT and you have a newborn?
Oh yeah, yeah.
That's crazy.
I was trying to work. Actually, I had to force my not force, but I played the hand of doing so many shifts early on.
Yeah.
Because they said that you can only do like a certain amount of shifts every week, and I was like, yo, I do this on a regular basis. I do 60 hours. Let me get
fun.
this done because I have a child coming.
Yeah.
And so initially, what always forget what they're called.
I can't remember
But
either.
like the professor, like overseeing everything.
Yeah.
She was like, no, there's like rules and regulations, bro. I went straight to the rule book, and it was like, if your professor allows it, you are allowed to do it. So I was like,
sick.
I literally screenshot that, sent it to her, and I was scared because she was a hard ass.
Yeah.
And so I was worried because I didn't know her yet, right? Like I was still kind of getting to gauge her.
Yeah.
And she was like, oh, you're giving me a hard time, Irv. All right, I'll let you do it. And eventually, I loved her. She's fantastic, but she held me accountable.
Yeah, you
like
have
she was
to.
one of the people who came in and she was like, no, I need to know their history, their meds, what they're doing, what assessments they have, diagnostic testing. What did you understand from that? I'm like, holy crap! Like she was pushing me.
You know what though? If I was you, and I don't know if you did this or not, this is just a guess. I would have never told people what I did for a living. Ain't no way, like because now people have that expectation.
But it is a small town, so I'm sure word got around that.
Like,
No, nobody knew. Nobody knew. Anytime I mentioned it, anytime I mentioned it, people were like, "What?" I was like, "Yeah." I was like,
because now they have like, okay,
Yeah.
like you're in class, you're asking a theory question that students may not know. Irv, you should know.
You should.
You know, like,
But then that's when you like look like the all-star. Like I said, growing up, man, I was never the all-star. I was fucking average student. Like nobody looked to me for answers.
Yeah, put me on the bench, coach.
So when it was,
I'm a reserve player.
Yeah, when it was that time, I was
Sixth man of the year.
So when I had the chance to finally show off, I'm like, bro, you don't fucking know this? Come on, 4th year. Let's get to it.
That's
right?
why that then when it comes down to like everyone's got 1-2 patients. Irv, you could do 5.
Yeah.
You know?
Like, and a lot of people were impressed. Like, you're doing 5? Like, yeah. You need another help on that hand? All my people are covered. Like, me and Molly got this.
Yeah.
Like, if you need an assistance, I got you, right? And people are like, man, it's awesome. But again, you always hope that transitions into other people being like, yeah, that student was amazing. That student was fantastic.
Oh, for sure.
Right? You're in your head, you're hopeful
It's
that
like a
they're
job
gonna
interview.
hire you.
Yeah, it's like a job interview. Absolutely.
And that's how I took it.
Yeah.
Whereas, like, by the sounds of what the story you were telling, that person didn't care. Like, they just want to get through school. And I'm like, no, this is an interview.
On nights, bro, she was like,
And the thing
sleeping.
is now that if that gets out and people know that, would that not make her unhireable? Or is that another
well,
claim?
you have to think, like, technically she'd be, like, unhireable to, yes, our unit, but I feel like now, at least the public perception is there's a need for nurses, right?
Yeah.
So, I mean, if when it's all said and done, the CNO certifies her, like,
How old
How
was
do
the
you stop
student?
her? She was a little bit old. That's the thing. She wasn't a kid.
Oh,
This
no.
is the worst part.
Come on.
She was a little bit older. She had a kid.
Tell me an adult
Like-
is acting and behaving like
Now,
this?
I don't think she was in her 30s like us, but I think she was like in her mid to late 20s. You know what I'm saying? And from what I remember, she does have a kid as well. So I'm like, bro, act right. Like, what the fuck?
Behave accordingly.
You know?
Like, what's wrong with you,
Yeah,
man?
bro. Crazy.
I never understood that stuff, man. Sometimes just that stuff was hard for me to get around because I'm like, I have a goal.
Yeah.
I'm here to get this shit done, do it well, possibly get a job here if I don't go to the States.
Yeah.
And then everybody's just like trying to just finish, struggle getting through, or they're fighting tooth and nail to like, be right on something they're wrong.
Right.
And I'm like, no, like you're wrong.
Yeah.
Take accountability for being wrong
And then just
go and
learn.
figure. Yeah.
And that's the
it.
thing. A lot of kids these days, they don't like taking accountability.
No, bro.
And that's why you have a lot of nurses that don't want to be in that preceptor role.
Correct.
Because shit like this can happen where
Exactly.
they'll go to the superiors and now you got to take time out of your everyday life to go to these meetings and be like, all right, so what's going on with this student?
Right.
They're saying you're racist.
See, here's the thing. This is actually exactly why I do not want a precept. Because people have asked me to, and I'm like, no way.
That's a lot
And
of
now
work.
I've never shared the reasons, but watching my coworker go through what she's going through is like, yo, you have to think. Now, she's like a skinny, tiny, little, small Italian woman. Imagine me, a big black nigga, and she says he approached me the wrong way.
Yeah.
What?
But again, she says you're playing the racist card, then it doesn't work.
No, but
Now
what I'm
he's
saying,
right.
it doesn't necessarily have to be the race card.
Yes,
though.
what?
What you have to, if you play to like my size and my color, people are gonna be like, yeah, he is big and black. He is.
But what does that have
He
to
is
do?
scary. Like, and I'm like, if you know me, I'm just a teddy bear, bro.
That's
I'm
what I'm
always just
saying.
messing
That's
around,
true.
but it doesn't matter.
Yeah.
Like these people that are now investigating don't know this little tiny Italian
100%.
girl on our
They don't,
unit,
yeah.
and her bully,
Yeah.
bro, I'll flick her off of me. What do you
Yeah.
mean bully? That girl that
But-
she's precepting could have beat her up.
Yeah.
Like, you know what I'm saying? Like,
Her character speaks volumes though, depending on how she's been. If she's somebody that people like enjoy and be around, she's gonna get a lot of backup. You know,
sure.
even your supervisor
Which
gonna
it
be
doesn't
like,
seem
no,
like.
she wouldn't do that. That's absurd.
Right.
That's absurd.
Yeah.
Right? And it kind of gets brushed off. But it all depends on what, you know, because I know some people where I'm like, yeah, that checks out. Yeah, she probably did get bullied, right?
Yeah.
But again, if this lady's like the sweetest person, which it sounds like she is.
She is.
Sounds
Yeah,
like
she
she
really
really
is.
cared to try and get this person
She
through.
really did.
Then if everybody knows that, then I don't think she has
This is
anything
the
to worry
thing.
about.
I don't know. It's just
Right?
And
this
the
is, but I think just with the demographic of a lot, not all. I'm just hearing a lot of stories. So a lot of the young people now, it's not about putting the work in, which I feel like it was with us. I feel like it's just getting things done easy. And if you get in trouble like this, bro, you just play to like the perception of things, and they do a very good job of doing that.
Yep.
That's where I get caught up.
But that I don't think that's the fault of like. I think that's just the society we're in now, right? Like it's everybody's gets offended, and we have to tailor to them being offended because nobody can be wrong or like the customer is always right now type of situation, which I always hated that.
I agree.
That term, right? Like customer's always right.
I agree.
You know, and you always see memes about it. It's like, okay, the guy who's been trained here for 2 months knows nothing.
Yeah.
And the customer who walked in all of a sudden knows everything.
Yeah.
But they're right. And it's like, you know what I mean? Like, it just doesn't make sense to me. And I hate that culture of like, they're correct.
Like, and part of it, like with all this, and truthfully, like this is something with me. I don't know if like I haven't shared this with a lot of people, but like even when I'm like changing a female patient, I will never be alone. I will never, ever be alone. And most of the time, if I can, I'll call on another woman to be in the room with me.
Fair enough.
Bro, I don't ever want to be in a compromising
you know what?
position.
And that's an important, like, thing to take into consideration. That's something I never thought.
Yeah.
Because I'm always under the impression I'm a professional. I know what I'm doing. And I always talk to patients before I do anything. Like, I'm like,
Me
hey,
too.
just so you know, I'm gonna do this. Just so you know, is it okay if I do this?
Yeah.
Okay. And I get it. Despite them being verbally, like, saying yes, you still have to have that level.
And these days you have
Bro,
to.
and a lot of the time I will tell women, listen, if you don't if you don't feel comfortable with me being as a man changing you or whatever, you let me know. I'm happy to get a woman. And most of the time they're like, no, it's fine. I don't care.
But
we're changing you.
You're
naked.
The nursing school tells us otherwise. The nursing school tells us that, well, you're their care. You can't always rely on other people to do your work.
Oh,
you have to educate that patient in your level of practice, the understanding that you're a professional.
Yeah.
Right? Because sometimes you can't. And that's what we were taught.
Yeah, sure. I'm gonna educate you with Irvin in the room with me.
Yeah. With the secondary
second set of eyes.
Witness.
Yeah, hell yeah.
But it's one of those things where it's like you can't always rely on that. Like you have to teach them like, this is my job. It's a profession. I do it with a level of profession.
You're not wrong.
And I
you're not wrong at all.
But I want to have a long career.
Yeah.
I don't want there to be misunderstanding.
And there's some women, it goes through 1 year and out the other where it's like, no, I don't care. You can teach me all you want. I need another.
So like in anything, like even when I am educating, like much like you, I'm making sure they're repeating back to me. There's an understanding. There is no misunderstanding. When you go home, you remember exactly what I said. I highlight shit on their fucking discharge form. Listen, if you're gonna come back here, there is a reason. Yeah. There is a reason for you to seek medical attention again.
Yep.
There ain't no, I didn't understand my nurse when G. No. And I'm telling you, when I'm in a room, even if it's like a patient that I have a great rapport with, and truthfully, I think a lot of the time they don't even realize what I'm doing. Yeah. Like a lot of the time, do I need help giving a boost? No. Look at me.
Yeah.
I'm 4 times your size. Like, you know what I'm saying? 90-year-old, 90-pound woman.
Yep.
Yo, Irv, come give me a hand. We're gonna boost this lady together.
That's my downfall, man. Because I'm like an 80-pound lady. I'm just shifting you up. I'm not slide. And I get like there's rules and regulations to that, but I'm like,
now don't get me wrong. Don't get me wrong. There have been situations where it's like, yo, it's the nights and we have like 8 patients and I just need to hurry up, and I'm just like in and out. Sure, but yo, I'm telling you, I'm never putting myself in a compromising position.
You know what? And that's I think something that you're helping me figure out that. It's kind of like see how it goes first, but at the same time, I don't want to risk it now.
Yeah.
Now I kind of want to start implementing that practice.
I'm like, yo, I don't ever need an investigation. True. I don't need, like, even, I know in my heart of hearts, I'm always doing things the right way. Yeah. That's really truthfully what I believe. When we talk about integrity, that's very important to me. But at the same time, again, I never want there to be any misconceptions. Yeah. I don't want any investigations. I got 2 boys I'm trying to show a good example to. I don't need them to see dad at home because there's an investigation at work of some bullshit that never happened.
That makes sense. And I think that's what's great about EMTs or paramedics.
You always have a partner.
We always have partners. So there's always that rapport of like, okay, if there is something that goes down, there's 2 incidents reports that are done, right? And for the most part, they're relatively the same. This is exactly what happened. This is how it went. You know, you guys are on the same page. You girls are on the same page. And it's like, you know, it's always a he said, she said. And that's just I think the downfall of the healthcare, like profession. You're held liable for a lot of shit, and it's like, what was it? He said, she said. Unless you're being recorded and there's a camera in the room, which obviously is illegal. Yeah. It's like, man.
So there is a story.
Not in Louisiana.
Yeah, in Louisiana they have different story, but this story that I'm about to talk about is exactly what we're kind of on the par with. I'm not going to say the hospital. There was a situation where there was a female patient that was getting sexually assaulted. Yeah. But she was intubated, and she was getting sedation, like propofol and those medications. So she would have her family come in during the daytime, and, they would be by her side, and there'd be moments where she'd be crying, it's like sobbing, and they didn't understand what was going on. So I guess one day the family, they didn't say anything, but they placed the camera.
Oh my God.
They placed the camera. No. And after a couple of weeks, they went through the film and they saw that she was being sexually assaulted.
Oh my God.
So
that's dark.
Very dark. So I think let me try and remember. So they went through the film. Okay, so they showed it to the higher ups, and they saw that a housekeeper was going into the room and was fondling the woman.
Oh my God.
Big situation, big issue. Fired the man instantly.
Of course.
Lawsuit, left, right, and center. But it was a big thing.
There's no fighting that one, man.
No, there ain't no fighting camera proof.
But even then, it's one of those situations like sometimes, man, they'll find a lawyer who can do it.
You're absolutely
It's like, that's bullshit. Right? It's like, no, I get to keep my job. It's like, no, you don't. That's ridiculous. But in the States, I think it's different. Unless that was Canadian news, but I feel like in the States, there's a lot of ways to fight that, which is sickening. But I feel like it's not something that hasn't happened before either.
Oh, no.
It's crazy.
I remember I read another article. This one was an article that I read, and it was in a nursing home where there was a lady. I think a nurse was actually having sex with some of these, with these residents in the nursing homes. Same situation. Camera was placed. Caught him in the act. Oh my God! Lawsuit on top of a lawsuit.
So this is the thing that's kind of like, what's the word? Like, it's talked about, and it's like controversial. That's the word I'm looking for. Where you'll have family members place cameras. Some people feel uncomfortable. Some don't. Honestly, I don't feel uncomfortable.
Not at all.
Because for me, everything I do, I really truthfully believe that everything is high level integrity for me. Yeah. So if you want to film me, sure. Yeah. But if you disagree with how I'm taking care of your family member, here you go. You do it. Yeah. Show me how you would do it. Yeah. Because I think I'm doing it to the highest level. Right. And I've never had anyone have problems. Right. And if you want to film me, better. Yeah. You want to film me? I don't need Irvin in the room now. No. Now you see that I ain't doing nothing crazy. Right? You know what I'm saying? Yeah. I don't need no misconceptions, nothing. Right. But then I've seen nurses get like really upset when family members they catch family members putting cameras and shit in the room.
Well, like for paramedics, unfortunately, we are public servants. Yeah. Right? So there are camera in our face, we can't really say no. Right. We can't be like, no, we are public servants. We are of the public, so they can record all they want. I've had people record me taking care of their, significant other doing, a cardiac arrest protocol, or not even a cardiac arrest protocol, like just a chest pain protocol, which is pretty simple. It's like, hey, these are what we got to do. This is how we got to move the patient. Yeah. And like sometimes my partner didn't catch it, and I'm like, hey, just so you know, we're being recorded. Yeah. And it's not like if they catch me saying that, that's fine. Yeah, I'm like, absolutely. Hey, they're recording me. Hey, the young lady there is recording us. Yeah. I just want you to be aware of that.
Absolutely.
So that everybody's aware of that.
Absolutely.
Right? Because if she can record, then why can't I just outwardly say that we're being recorded? We are public servants, and that's the way it is. And it sucks because it's like now you're under the thumb because they're, there was a story where somebody was recording the situation,
Yeah.
and it became a whole investigation, and it was like, and it sucked.
Yeah,
It sucked for that person because
Absolutely.
they're trying to do the best they can for this person,
Yeah.
and other people believe we're not.
Yeah.
Other people believe that they're not doing the most, but we have certain standards and things that we have to do and ways that we have to move
Yeah.
for this person to have the best outcome that they can.
Absolutely.
Right? There's things we have to do on scene before we move the patient. Some people still think we have to bring in the stretcher.
Yeah.
Some people think we still have to bring it in through the door, down the stairs, in the basement,
Yeah.
and somehow carry this 300-pound thing plus a patient
Yeah.
out the door. Like,
Yeah.
I've had people come in and like, aren't you bringing that in? Or it's like, don't worry about bringing that in. I'm like, no, we don't bring that in.
Yeah.
Like, that's old. I don't know who's done
Wait,
that.
hold
in the
on.
past.
Question. Let's say there is a 300-pound person in the basement. How do you get them out?
We have what we call either a mega mover,
Okay.
right? And it sounds terrible.
That's
It's not.
crazy.
But it's
That's
just a mega
crazy,
mover
dude.
because the reason it's called a mega mover is it has handles on the bottom, the top, and the side for multiple people to hold on
I got
to
you.
reduce, obviously,
Yeah,
the
yeah,
effort
yeah.
everybody has to do.
Absolutely.
Right? So we've had that. I've had, like I said, we've had cardiac arrest patients, the bottom of a staircase, narrow,
Yeah.
one person can only fit.
Yeah.
And they're 250, 300 pounds. And it's
Holy
like,
shit.
but they're viable and
Yeah.
we can try and work them. And we have to get them to the hospital. And it's awful. It's terrible. Some
sure.
people don't realize how, like,
Bro, it takes you, like,
strenuous
30
this
minutes just
actually
to get
can
them
be.
out. Yeah.
100%. And it's like you have to do that with intubation sometimes. You have to do that with, like, lines and water and fluid, everything going in. It's like, and it's a lot. And that, all that stuff gets, like, documented. Right?
course.
All that stuff gets charted. Like, chest compressions are recorded.
Yeah.
Like, so if there's, like, a lack in compressions, like, our higher ups can see that stuff, right?
Wow.
They can see, like, the changes in, like, our rhythms and our monitors and all that.
Really?
So they're like, oh, like, what happened here? It's like, we're extricating, right? So it's a
Yeah.
simple explanation, but it's
Yeah.
like, it's to kind of help with the effectiveness and
course.
kind of improve
Of course.
outcome for patients,
Yeah,
right?
like quality
Which is-
improvement,
yeah,
essentially.
right? So
Yeah.
it's fantastic, but it is tough. Like I said,
I can
especially
imagine.
it's hard. But yeah, those 300-pound patients, 400-pound patients, they're tough, man.
I can imagine.
Like
bro.
and like as strong as a guy as I
It
am,
don't matter, bro.
you still need assistance.
You gotta go up a
man.
staircase with that big
Yeah.
ass motherfucker.
I think I've only
Yo,
called for a lift assist once.
Dog, if I'm at the bottom of a staircase, chest pain, fucking angina, MI, whatever.
Yeah.
Leave my ass down
No,
there, bro.
man.
Leave me at the bottom of the stairs.
we can't
G.
do that,
That's crazy.
Yeah, that's what makes us a hero.
Oh, healthcare heroes.
Not everything else. Not just bringing you up.
one last question for you. Okay? One last question. EMT or nursing?
EMT.
Yeah?
Yeah, and I'll proudly say EMT.
Yeah.
Because with EMT, like that emergency medicine adrenaline rush
Yeah.
is what people sometimes get in the ED,
Mm.
right? And all across the board, for the most part, a lot of people they'll consider it the same kind of adrenaline rush. Where like if you're in an ED, sometimes it's like low acuity stuff, and then
Yeah.
you get that like, oh my god, that trauma.
Yeah.
But the fun part is stabilizing that patient out in the field.
Absolutely.
Like when we bring them to the ED or to the hospital, cool. We already have them set up.
Yeah.
They switch beds. You guys do the rest. Nurses do the rest. Like police, everybody else does the rest, right? Where it's for us, sometimes it's just me and my partner, man.
Yeah.
Me and my partner finding
Grinding.
somebody in a ditch or something like that, bringing them up and like requesting backup, waiting for backup.
Yeah.
And then on top of that, waiting for other paramedics. And it's like, we have to try and keep this person alive
Yeah.
for as long as we can until we get help or we manage to get them out of their situation into the truck.
Yeah, right.
Stabilize them, assess them, do our skills, and then bring them all the way to the hospital
Right.
and keep them alive.
Yeah,
right?
that's right.
Like there's people who die on route, there's people who come back on route, and it's just like that adrenaline rush is why
Yeah.
I do it. And that's why, like I always say, I don't want to do the bedside slow stuff.
Right.
I want things to keep me on my
High
toes,
pace.
right?
Yeah.
Like high pace, just I need to be monitoring them. Okay, I got to watch these changes. Versus
Yeah.
like somebody staying very stable, and I just got to make sure they're taking their meds. Like
Yeah.
I can't do that stuff. Like
Yeah,
that
that's
stuff for
fair.
me doesn't interest me.
That's fair.
But also with like the downtimes, right? You get the opportunity once you leave a patient, you get a breather.
Of course.
Whereas I find nursing, you're just
You're on the go.
constant, right?
Yeah.
So it's one of
Constantly.
those that's why I kind of want to choose. I prefer paramedicine over nursing. And like I
Yeah.
said from the beginning of the story, right? It wasn't my first option.
Of course.
It was one of those
Kind of rock in a hard place.
rock in a hard place,
Yeah.
right? But the
Had to
opportunities
finish.
that are available as a nurse, I could go and do stuff in Japan. I could go
Yeah,
do
it's
stuff
true.
in Australia. I could go. My sister's done Hawaii. You know what I mean? So,
Yeah.
So I guess my last question, actually, I did want to talk about Japan a little bit too, but one of my last questions is, what would you tell a nursing student or someone who's thinking about getting into the profession of nursing, or even EMT trying to make that transition into nursing?
actually, you'd be surprised. We have a couple of paramedics trying to become nurses right now.
Oh, yeah.
Wow.
I think they'd be in they're coming on their second year, so they just finished the first year.
Yeah.
I haven't followed up with them of how they feel, but again, they're in the same situation I am. Right, a lot of this stuff they understand. Actually, we have one of our high level paramedics in nursing right now.
Yeah.
She's super bright, like probably one of the smartest in our service,
Yeah.
and she's just like she loves what she's learning.
Yeah.
She's like, oh, she never thought she would learn about action potential again, and now she's like, back in the day she didn't like it, and now she's delving more into it. She's like, it's making more sense. I think that's just with the maturity.
I think so. I think when you're like practically doing hands-on and then you're in class, like when you're actually working as an EMT, not necessarily a student where you're taking in all this information, but you're an experienced nurse or EMT, and then you go back to school and then you relearn these things, you're just like, wow.
It's far
making
more
sense.
interesting.
For
And then
sure.
like again, she's just bright, right? So I think she's in the same boat as me in terms of like certain things just click better.
Yeah.
And so when I think when anything makes more sense, it's easier to take in, and
Sure.
it's more
Definitely.
enjoyable, right?
Yeah.
So she's just like, okay, like she's done cardiac arrest, she's done this, she's like, but now she's learning simple as action potential and where like why it works and how it works, and
Yeah.
she's like, now it's making more sense. Like I actually
sure.
like it. Like it's so. I think like a lot of people, again, for me, it was more of like the openness of being able to do a couple of things. Like I know a lot of nurses. My sister's a nurse. She's done the traveling thing. There's a lot of people, you know, like your wife. She's not a nurse, but she is doing something with that profession,
She's a
right?
nurse. Yeah, she's a nurse.
I thought she does the nail stuff,
No.
or not
Angela's
the
a
nail, the
doc.
injection stuff.
She does, but that's like her business that she's starting. But she's
That's
a pediatric
okay.
nurse.
Oh,
So if you ever
sweet.
want to go into peds, that's someone you can
There
talk
you
to.
go.
Yeah.
Right?
Yeah.
So again, look, you can do both,
Yeah.
right? You can do something you like for extra money.
Yeah, that's right.
The income is like it's up there, right?
Yeah, you're
Whereas
right.
with like EMT, like you're stagnant in terms of like your pay. You only get paid what you get paid based on like, you know, contracts and whatnot. Whereas nursing, there's really no cap,
Yeah.
right? So I think
you're right.
was it you that was telling me that you were doing nursing in Arizona during COVID?
The
No,
pandemic.
the pandemic.
Yeah,
So
and then you were just
not Arizona,
He was in
Louisiana.
and you were just cashing in, and I was just like sitting
Yeah.
there. My sister was in California at the time, cashing in.
Yeah.
California's the
like-
highest state paying. Yeah.
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 And I was just like, this is what you're making. I'm like, wow. You know what I mean? So just that opportunity. I mean, you guys went through the grind of it all. Like, it was awful. I can only imagine. But there's always that, like, the ability to do a lot of different things and change what you're doing.
Yeah.
Whereas paramedic, you're doing the same thing.
Yeah.
Either you just advance your skill set, but you're still doing the same call volume. You're still doing
Yeah.
the same people. Sometimes you don't get to practice those high skill things that you've learned.
Right.
Whereas with nursing, you can.
Yeah.
You can go learn something, use it constantly, go learn something else, use something constantly. So the question was like, what would you like if I was to tell a paramedic?
Like,
what
oh
about
yeah,
nursing?
a
Like,
student
you know what I mean?
nurse, someone who's thinking about getting into nursing, EMT that wants to get into nursing, what can they expect?
If
And
honestly,
what advice
just-
would you give them?
I think if you're specifically looking at paramedics getting into nursing, just do it. Right?
Yeah.
If you feel stagnant in what you're doing, then just get into it. You know, it's gonna feel boring at first because again, we have that solid foundation of knowledge,
Yeah.
and you kind of have to just go through what you go through. But at the end of the day, it pays out, man.
Yeah.
Pays out. It's gonna do you good. It's gonna be tedious. You know, a lot of it's gonna be redundant.
Yeah.
A lot of it you're not gonna agree with.
Yeah.
You know, there's a lot of shit in nursing I don't agree with.
Yeah.
But at the end of the day, it's how you practice, and at the end of the day, it's whatever you want to do, and you can do what you want with nursing, and you can practice however you want to practice. Like I said, I want to do cardio, I can go do cardio. I get your cardiac. I don't have to
Yeah.
do simple shit, right?
Yeah.
So
Absolutely.
you know, so I just say do it.
Yeah.
Say if that's what you want to do. For me, I think the aspect of even traveling is fantastic.
Yeah.
What other profession really gives you the opportunity to kind of just go up and get contracts and change, right?
Yeah.
Other than like engineering, like my brother.
Yeah. In Japan.
Japan.
Shout out Emerson, my
shout out
guy.
my brother, just
Emerson's
living
my
the dream.
guy.
Yeah.
Yeah, no, there is a lot of shit in nursing. Literally,
Yeah,
your hands will get dirty.
What did you say? Piss, shit, and wipe.
Piss, shit, and wipe.
You know what? I think I've only been shit on once, and that was like it like just fell off the bed kind of thing.
Damn, you're lucky, G.
Once. That's it.
Like it hit you, or like the
Like it just fell off the bed and just
landed
hit
on
my
your
leg,
sneakers.
man. I was like, I'm not gonna change. But that's once, and I was surprised. Like I'm very careful and cautious with that stuff, man.
man. I've seen a girl get hit with shit on her upper lip.
Oh,
Yeah.
Whoa, nope.
that's when I say I quit.
Well, you said I backed up from you like it was your lip. Like, nah,
It wasn't my lip.
No,
Flexi Seal. One of those like rectal tubes. That you,
I know exactly what you're talking about.
no.
That's gonna make me vomit, bro.
Upper lip. I
haven't
didn't see.
experienced that
That's
yet, I'm not
disgusting,
ready.
G.
I didn't see her at work for a couple weeks.
Nigga, I would be on a leave of absence, stress leave.
I think she
I'd
was.
be-
Yeah.
I think she was.
A flexor seal bump up.
Yeah,
Oh,
she got a bum bump. Yeah, Kevin Hart bum bump.
Oh God.
Awful, dude.
Oh, that's disgusting.
Yeah,
If
man.
you don't know what a flexor seal is, look it up. God, I'm like
Yeah.
gonna vomit just thinking about it.
Yeah,
And
rubber
I'm like a
tube that goes up the
germaphobe,
butt.
man. So like when I deal with that stuff, I'm just like super cautious.
Oh, bro, I can't stop thinking about it. I'm like getting nauseous.
Yeah, like these days, if I ever clean a patient or wipe a patient, I gotta put on a gown, everything. I'll
100%.
double glove,
Oh,
triple
for
glove.
sure.
Yeah,
For sure.
Yeah.
Yeah, I'm using resources that the
Oh,
hospital has.
100%.
That's what they're there for. Like
Yeah,
Exactly.
that's
It's a fact.
literally what
Big
they're there
time.
for.
Oh my God.
And some
Big
people are like,
time.
nah, I'm good. I'm like, nah, just wait.
Bum
Now
bum.
you're on stress leave.
I
Yeah.
think for me, the worst that I've ever had is I had a guy just like throwing up bile on us one shift. Like, yo, liters and liters of bile just fucking coming out. Like to the point where like me and like 3 other guys, we couldn't wear our sneakers the rest of the shift. Like our shoes, he was just like, we had to go get surgical scrubs, and then we literally were just working. Like we put like the surgical caps on our feet.
Oh, the surgical
Yeah,
booties?
so we got the hospital socks. We got surgical because we all had to put our like shoes in a bag and shit because he got us.
That's insane.
Yeah,
That's
bro,
the
it
tough-
was so much. That's the most I've ever seen anyone throw up in my life.
That's the hard part with us, right? I feel bad because we're wearing the same uniform for the most part. And
Yeah.
We're just going house to house. And you can go from
Oh yeah,
a rat-infested, cockroach-infested home to a South Windsor beautiful mansion. And
I
you're
never
like,
thought about that.
you're just like, damn it. Obviously, we take the precautions to like clean our
course.
boots and everything. And if we have to do a uniform change, we just go out of service, figure that out. But you still like, not everything requires that.
yeah.
So you just still feel bad because you're like entering somebody's home with your boots. Like
Yeah,
you're not
yeah,
taking
yeah.
your things
Yeah.
off.
No,
So I
absolutely.
mean, at least with like nursing, you can kind of take those precautions. We do our best, but when it comes to our boots, it's like damn it, like
Yeah.
you're just walking through people's homes.
Yeah, I didn't think about it like that.
Yeah,
I didn't either.
But one thing that you were talking about was the different things that nurses can do in this world, whether it be travel nursing
Yeah.
or being a cruise ship nurse,
Yeah.
prison nurse. There's so many things that nurses out there can dabble into that they don't really educate students in school with. So just for the nursing students out there. But before we end, I wanted to ask you about Japan. How was that experience for you? And how would you compare the healthy life or the health lifestyle out in Japan compared to like the U.S. or Canada?
it's life changing experience, and I keep telling my brother this, and he's like laughing about it because like it's such a culture shock. It's amazing. Like the cleanliness there is insane.
crazy.
What they can put into their foods is restricted, so it's
Right.
for the most part it's healthy.
Wow.
I ate a lot, and I never once felt sick. I never once felt like I was like bloated, heavy, any of this stuff.
Yes.
Because that's something that they pride themselves in.
Yeah.
The work culture there is apparently shit. I mean, like I said, you see people 90 years old still working. They don't have, I don't think, from what my brother was telling me, they don't have retirement plans.
Yeah.
Like the culture there is just to keep working. Because now, if you start doing this retirement thing, now the government, like people are relying on the government for stuff when
Yeah.
it shouldn't be like that. So people need to continue working in order to like reduce crime and whatnot and stuff like that apparently. And just like, it gives people purpose,
Yeah.
which is what I think we're failing here.
I
Like,
agree.
People
Yes.
they rely on the government, and I think that's what's fucking things up.
I agree with you.
And with that being said, like, it's funny enough, it makes me hate everything here.
Yeah.
The other day, I was driving to work. Some girl pulled out of her car, so she was in the passenger side, took her, I believe it looked like a ramen bowl dish or whatever, put it at the side of a fence in a park and just left it there, just littered for no reason. And I'm like, what? Instantly, I was like, I hate this place because there's no garbage cans. Like as you know, right? There's no garbage cans. If you carry garbage or you're carrying something that becomes garbage, you have to hold on to it till you get back home.
Yeah.
Which is fantastic. Yeah.
Japan.
The culture there is like,
there's,
like the only time you can like get rid of a bottle is right next to like a vending machine.
Yeah.
Like you got to drink that thing and leave it there. Otherwise, you're carrying it for the rest of the day until you find another vending machine with a garbage disposal can, right? But like that was like the culture shock there's phenomenal. The food's amazing.
Oh
like,
man,
it's even frowned upon to eat when you're on the subway or walk and eat.
Which I just heard that on a TikTok like yesterday, and I was like, "Fuck!" I ate while I was walking because I'm like
uncultured swine.
Yeah, because we're just moving,
fucking
right?
dripping sauces on our trains and
the
shit.
thing is, like you could find high quality food at a convenience store.
Oh, for sure.
Yes.
Lawson, Family Mart.
So I've only
like
ever had
7-Eleven.
a really long layover in Japan.
Yeah.
Until this day, some of the best food I've ever had, and it was in the airport. Like amazing and so clean.
Yeah.
The people were so nice.
There's this video of like Anthony Bourdain, and it shows like kind of his experience, and he says, you know, I saw it before I went to Japan, and it's like this guy's like, the only way I can explain going to Japan is it's like you're taking acid.
Yeah.
And when I first I'm like, oh man, I'm excited, right? And you get there and it's exactly like that. Like, not that I've taken acid, but I can only imagine.
If I had taken acid,
if I had, right?
Yeah.
But like just that whole like it's not real. It's like you're like, no way. Like this doesn't exist. People are so polite. The culture is amazing. Like I said, the work culture I'm sure is a whole different story. My brother says like going to work, absolutely annihilated. Like the culture there is just grind, right? They start at like 10, but they don't finish till like 10. So they work 12 hours just corporate America. Yeah. Right? Corporate Japan. Yeah. But in terms of just like Japan itself, man, like I'm already planning to go back, right? Like there's a lot of stuff I still didn't get to see. You know, it's hard because like I'm still trying to wrap my brain that it exists, a place like that, in terms of just how clean it is. The foods you can't miss. Anywhere you go, there's no missing on food, right? And then like I showed up here and I was like, damn, fuck all these fast food places. I'm like, I hate it. The convenience stores aren't the same. Like this is trash, right? Yeah. And it's just that perspective. And I think I'm gonna hold on to that perspective for a while, just because it's of how amazing Japan is, man. Yeah, everything's affordable, and it's like, you know, for the average person traveling.
There's 7-Elevens, it's high. It's high level, high quality, man. There's even a restaurant called Coco Curry. I don't know if you ever walked by it.
No.
If you go next time, go to a Coco Curry. Okay. Amazing. Okay. Then I had Wendy's. Their fries, 10 times better than Wendy's here in the States. I just
saw that the other day that apparently Wendy's in Japan has the greatest type of like fast food. They have like the off quality. Yeah. It's like legit real just Japanese food, but somehow in a Wendy's form. Right?
Yes.
But they said it's amazing, and I was like, oh wow. And I try to avoid it, right? Because I'm like, we have Wendy's here, we have KFC here.
Try it. So hell, just get their fries, and you'll taste the difference.
Because like me and my brother on like our late nights or whatever, we got McDonald's, and it was awful. Really, it was the worst thing ever.
You know what? I find McDonald's outside of North America actually sucks.
Yeah, it's.
I mean, their menu list is different.
Yeah.
I mean, it's probably better like quality food than here, but I just. You know, when you hit that Big Mac or them fries, and it
what it is, and I think like when you ate the fries too, it doesn't have all those like preservative stuff in it. Yeah. So it was like probably fries cut that day. You know
what though? We went to a McDonald's in Bali.
Yeah.
How was that?
It was amazing, bro. It was like I got like fried chicken. We got fried chicken when we were there.
Damn.
Amazing.
Yeah.
It felt like you were eating real chicken too. Like,
but again, I think it all depends on what the country demands.
That's true.
Yeah, McDonald's wants to be in there. Fine, you got to follow our food guidelines.
Regulations. Yeah,
this is what we're doing. You're not putting that shit in here. Don't send me this stuff.
Yeah,
so it's healthy, right? So at the end of the day, like I said, culture shock, beautiful place. Like everywhere you go feels new every time, different. Shinjuku Station, awful. Hard to get around that station. They actually make TikToks about it too. And I was like, I got lost always at that station. Every other station fine, but that station, bro, you could not find the connecting train. Damn. But yeah, traveling's easy. It's just, dude, it's just a whole. It's like a soul opening type place where it's just like you didn't know existed. I didn't want to move there. I legit would love to move there and just, but I don't have a profession that allows me to go there.
Right,
yet,
the language barrier. I would love to work as a nurse out there, but the language barrier is just too hard to break.
Yeah.
And there's no crime. Police officers don't carry
That's what
guns.
I heard. Yeah, I heard that too.
As far as I know,
I don't even think I remember seeing an ambulance just drive by. Wee, woo, wee.
I
didn't
saw
hear none of
3 ambulances and 2 police cars. I don't know what they were going for, but like the entire time I was there in a big, massive population like that, I expected more.
Right.
Barely anything. Right. So it's just one of those places where it's like insane.
But yeah, no, thank you so much for having us.
No,
Yeah,
thank you for having
I think
me.
you opened some good perspectives.
Yeah. That's season 20. No, season 20.
Damn,
Episode
man.
20.
We old.
I know, we old. Episode 20, season 2 finale. Thank you to Irvin for being our
Shout out
guest.
Irv.
Make sure make sure y'all like, subscribe, comment, YouTube, Spotify. We're on Apple Podcast, Facebook, all that. Let's get that number up.
Let's go.
And yeah, we'll release more episodes as we go.
Let's go, baby.
That's it.
Peace.